Good morning and welcome to the Committee on Ways and Means. Committee Secretary, will you please call the roll?
Assemblywoman Anderson. Assemblywoman Backus. Assemblywoman Brown May. Assemblywoman Dickman. Assemblywoman Gorlow. Assemblyman Hafen. Assemblywoman Howdigi. Assemblywoman Kasama. Assemblyman Miller. Assemblyman O'Neill. Assemblywoman Peters. Assemblyman Watts. Assemblyman Yeager. And Chairman Moreno.
And I am here. We have a long agenda for us today, and we will be coming back later for a work session, so we will not be adjourning this morning. We'll be recessing. We may be coming back 2, maybe 3 times today, so y'all gonna really love me before the day's over or hate me, one of the two. I'm not sure which. Just a few reminders, if you do have an electronic device, please turn that off or mute it so it does not go off during presentations to interrupt the proceedings. We will have public comment at the end of today's meeting whenever that happens. I'll give out that number now. It's 888-475-4499. The meeting ID is 841-0504-1270, and then please press pound. We will be taking some bills out of order today so that members can get to their own committee meetings, but we're going to start with a BDR introduction. And I will remind members that your vote in the affirmative for this BDR introduction doesn't say that you will support the measure once it becomes a bill. It's just to move it along in the process. So with that, the BDR is BDR S-1225, which makes appropriations for various purposes relating to health, education, and employment. Any discussion? Seeing none, I'll accept a motion.
So moved. Second.
I have a motion from Assemblywoman Backus, a second from Assemblywoman Howdigi. Any discussion on the motion? Seeing none, all in favor, please say aye.
Aye.
Any opposed? The motion carries. Thank you. All right, so as I stated, we will be going out of order with a few of the bills. We are going to start with Assembly Bill 139 and open that hearing. Assembly Bill 139 revises provisions governing certain demographics information collected by governmental agencies, and will welcome Assemblywoman Miller to the table. Good morning.
Good morning, Chair and Vice Chair and members of Ways and Means. Is this on? Okay. Good morning. For the record, I am Brittany Miller, the Assemblywoman representing District 5 in Clark County, and I'm here to present Assembly Bill 139 to you. And Assembly Bill 139 requires that governmental agencies that already collect demographic information include a category for the MENA distinction. MENA stands for Middle Eastern North African. And so I know that we are in ways, and I know there's a huge list today, and I know that we want to be brief, so I'm going to be very brief with my presentation on what this is. Basically, the Arab world covers 22 countries that are part of the Arab League that stretch from Morocco through the Middle East. And the Middle East is generally a geographic distinction that includes Egypt to Pakistan. And so with that, we know, we just had a census here in this country recently, but we know that the way that states receive funding and support from the federal government for things like education, housing, language access, financial aid, research, and other things are through these numbers. But what happens to people of MENA descent is we are often diluted or absorbed into other categories. So for instance, if you are Arab, you may be from Egypt. But if you're from Egypt and you're filling out these forms, because Egypt is in Africa, you check African, African American, which then by data makes you represented as what people assume as a Black American. If you are also an Arab, you may be from Lebanon, like my family is, but you have been legally distinguished as white. Of course, when me myself, even this last census, when I checked Black and then had to go to the white category, and there was a drop down for Lebanese, but the point is, it included me as white. And again, the assumption is white European. Lebanon's actually in Asia, so we're actually Asian. So what happens is many Arabs are either being classified as African, Asian, or white, which doesn't give the actual numbers and the ability to collectively as a community go for the resources or have the ability to drive policy or have the ability to even on a personal level be recognized and acknowledged for who you are. MENA itself, the reason why we say Middle East and North African is, again, Arabs are the largest group in this, in the MENA category, but it also includes, it's not, while Arabs are the largest group, not everyone in the Middle East is actually Arab. This would include Persians, Kurdsmen, Chaldeans, Assyrians, Armenians, Berbers, Turks, and Israelis. We are all in this MENA category. Just to give you an idea on numbers, the last census estimated that there were 2.1 million Arabs in the United States. Again, we don't know specifically because many are trapped between either African, white, or Asian. When the Arab American Institute did a community survey, that number actually doubles to 3.7 million Arabs. It is estimated that within this entire MENA category, there would be up to 7 million Arabs. Here in Nevada alone, we have data that says there's 17,000 Arabs. What's unique about that number is that is a 42% increase between 2000 and 2017, making Nevada one of the fastest growing Arab communities in the country. But again, we're not collecting on all of our other groups under this MENA category. And we do know, Nevada, we are the third most diverse state. We are positioned to be the leader in this nationally. There's only one or two other states that are doing this or even attempting this at the time. We know that our Clark County School District represents, our students represent over 100 countries and they speak over 100 languages. So again, we as Nevadans with our rich and robust diversity should be on the front line of this movement. With that, I also would like to remind people just on a personal level how important it is for people and communities to be accurately identified and recognized and accurately counted and included as how they identify. With that, I'm happy to answer any questions, but I will just briefly refer to the actual fiscal notes. As you see, there is an amendment on Nellis. One fiscal note, one amendment that I did submit would allow it to be permissible. I changed the language to may for all of our justice entities. That would include law enforcement, the courts, and corrections. And the reason for that was because many, some of our entities like Highway Patrol and PMP didn't submit a fiscal note, but others within law enforcement and the courts, because this is really a systems update that has to be done, and we all know that we're in different places with our leases for our computer systems and all that stuff. But ultimately, this is about, while we always want the numbers and the data within justice to see if there's any inequities, the goal of this is first to be counted. And so with that, I am comfortable with allowing those who are able to right now to participate, and everyone else knows that that's something we will be moving toward. That amendment alone resulted in a $600,000 reduction in fiscal notes. The other major reduction that we see is from DHHS, and I believe they're at Grant Sawyer today to testify that their original note that came in at $829,000 for the next 2 years has been reduced to $140,000 for just this first year. There's still a few other fiscal notes remaining, some as small as $200 from Lyon County. We appreciate you. There's only been one school district, Carson City, one city, Reno, that has asked for fiscal notes. But ultimately, that's it. I just ask for your support for Assembly Bill 139, and I'm open to any questions.
Good morning, and thank you for the presentation. Let's go through the fiscal notes. What is still there, what's not there, what's been reduced?
Okay, so starting with the reductions, DHHS reduced from the $829,000 for the next 2 years over the biennium to $140,000 just for this first year. Reno is still asking
Hold on
for.
one second. Hold on one second. Is there someone from DHHS here that could speak on their,
Yes, she said she was going to be.
here we go. We have
in
someone coming to the table.
Grant Sawyer,
in Las
yes.
Vegas. Perfect. Good morning.
Good morning, Madam Chair, committee members. For the record, Kelly Cantrell with the Division of Welfare and Supportive Services. And Assemblywoman Miller is correct. We reduced our fiscal note from $829,000 to $140,400, a one-time fee. Thank you.
Perfect. Thank you so much. And with that one-time fee, would your agency be able to absorb that amount, or would you need an appropriation to cover those dollars?
Kelly Cantrell, for the record, we would need an appropriation to cover those dollars.
Thank you.
Thank you.
Your next fiscal note.
The next major reduction.
Yeah.
Okay. The next major reduction would be collectively around $600,000 from our justice entities. So that would be $300,000 from the administration of the courts, because the courts have been amended out.
So the 300,000 has gone away, or it's still there?
It's still there. I had asked people, and there were groups that told me that they couldn't resubmit fiscal notes, but they would be here to testify.
Okay. So if we have someone from the courts that can speak on their fiscal note, if that 300,000 in FY24 for the systems programming costs is still applicable, I invite you to the table if you're in Carson City or in Las Vegas.
Okay, let me
Not seeing
move.
them. We can move to the next one.
Yes, the next one would be Department of Public Safety Records Communication and Compliance, and that would be Ms. Souza. That was $294,000, also reduced because they have been amended out. And I think those were actually the two major ones from law enforcement.
Thank you so much. Is there someone from the Department of Public Safety and Records that can speak to the fiscal note? As for the $295,207 for FY24, if that has been amended now to zero or reduced? Not seeing anyone, we can go ahead and move on.
So those are the major reductions. The ones that still remain is there is 15,000 from DHHS for public and behavioral health. And I have reached out to all of these entities. There is 2,000 one-time shot from Dieter, $2,083. Carson City School District is asking for $20,000. Lyon County is asking for $200. Again, I appreciate that fiscal note. City of Reno is asking for $14,500 over the biennium. And Silver State Health Insurance Exchange is asking for $50,000. And I believe that Mr. Lopez is also on the line, calling in or available today as well. And those would be the actual financial ask.
Perfect. Mr. Lopez, by chance, are you with us either by phone this morning? BPS, do we have anyone on our phone lines?
Please press star 9 if you are a part of this.
Hi, this is Jonathan Lopez for the record on behalf of the Silver State Health Insurance Exchange. And yes, we do have a fiscal note for $50,000. That would be a one-time fee in fiscal year 2024, and we would be able to absorb that cost.
Thank you so much. And my question for you on that $50,000 in FY24, will you, your division be able to absorb that cost?
Yes, Jonathan Lopez for the record. Yes, we will.
Perfect. Thank you so much, and thank you for joining us. We appreciate it. Assemblywoman Miller, the conceptual amendment was helped in addressing some of the fiscal notes. That's why they were able to be brought down. Perfect.
Yes.
So we'll have to amend that in this committee before this can be work sessioned. And then if we can get confirmation from the other entities that weren't here today as to what their fiscal notes are.
Sure.
We could do that before moving forward. Members, do you have any questions for the presenter? Not seeing any, then I will ask you to take a step back, and we'll invite anyone to the table that would like to testify in support of Assembly Bill 139.
Thank you, Chair and members of the committee. Good morning. My name is Eric Jeng, ERICJENG, here on behalf of One API Nevada and our sister organization, Asian Community Development Council, ACDC. Last month, both of our organizations have sent in public comments for federal side on proposals of updating OMB's Office of Management and Budget's race and ethnicity statistical standards, including the MENA category, the Middle Eastern and North African categories. And today we're here both for the same principle, the principle of self-identification and the principle of disaggregated data, to hear and advocate for our community in order for data to properly reflect our state's population. It is essential that individuals have choices that allow them to ample and clear opportunity to express their self-identity as accurately and completely possible. Broad racial and ethnicity categories do not allow for full understanding of our population, and the aggregated data disguises underlying trends that can illuminate needed policy remedies and show where progress is occurring. As a community organizer and advocate that is doing the groundwork on direct services, grant writing, and policy recommendation, we know without accurate and timely disaggregated data, this population will not receive their fair share of benefits and services. So today, in solidarity with the Middle Eastern and North African communities, in our great state. I hereby come here and urge for your support. Thank you.
Thank you.
Good morning, Chairwoman Moreno, committee members. For the record, my name is Emily Prasad Zamora. That's spelled PERSAUD-ZAMORA. I'm the Executive Director of Silver State Voices. I hope you all are caffeinated and got a little bit of rest after a long committee hearing. But one thing about that committee hearing that was very apparent is that data is important. There were lots of conversations yesterday about numbers. And one thing that is really important about numbers is not only does it tell us about the price tag or impact, it tells us the stories of people. It tells us the stories of our communities. And we're talking about a specific group, the Middle Eastern and North African community, that is growing within the state of Nevada. And we want to be able to accurately know how many of these folks are here, what is the impact of their particular community, so that we're able to serve them accordingly. As a civic engagement organization, everything that we do, data is centered in that. And as we've been able to knock on many doors, create strategies for lots of different civic engagement things, we always have to look at the data. If we don't have the data, then we don't know that we're executing our strategies, whether it's a GOTV program or a voter registration program, in the best way possible. So we urge your support, and thank you so much.
Thank you. Good morning.
Barry Cole, Barrycole, as an unintended medical implication of this legislation, I want you to know that medication decision-making often reflects ethnicity. That may surprise you. But we know that in the Middle East, there are many carriers of what is called an allele, a gene specific for drug metabolism through a pathway called cytochrome P450-2D6. I'm not going to try and teach that to you in like 2 minutes, but the implication is that they're hypermetabolizers, so they can go from a benign precursor medication to a very toxic ultimate medication, codeine going to morphine, hydrocodone going to hydromorphone. Knowing how many people have this variant will have implications for the cost of health care. So an unintended benefit is we actually will know who's more likely to have a drug interaction or an adverse drug effect. I really urge you to look at this critically and go for AB 139. Thanks.
Thank you. Is there anyone else here in Carson City that would like to testify in support? Seeing none. Is there anyone in Las Vegas that would like to testify in support of Assembly Bill 139? Not seeing anyone. BPS, do we have anyone join us on the phone line that would like to testify in support?
If you would like to testify in support of Assembly Bill 139, please press star 9 now to take your place in the queue.
Hello, my name is Jazel Ozuna, Jaadielozuna. I grew up in Vegas and I now live in Reno. I support AB 139 as someone who is Filipino and Mexican American. I understand why it's so important to have terms as AAPI and Latino. I grew up around Lebanese family friends and been able to work with the Afghan refugees who now call Nevada home after the fall of Kabul. Having MENA be represented in our state will make the people I love to be able to be seen and heard in our state. It's so important that people aren't overlooked, and this is a simple thing we can do for the MENA community. Thank you so much.
Thank you. Next caller.
Good morning. For the record, my name is Craig Valdez, spelled Craigvaldez. I'm a community organizer in the Asian American and Pacific Islander community in Southern Nevada and also a member of the AAPI Democratic Caucus of Nevada. I'm calling in support of AB 139 because while it is estimated that there are over 30,000 Nevadans of MENA descent and approximately 300 Nevada business owners of MENA descent, we don't know the full picture because of the lack of properly aggregated data. One of the vitally important issues in our community is that we are not a monolith, We are a diverse group of individuals who speak different languages, eat different food, celebrate different holidays, and are all affected by different issues. AB 139 will allow members of the MENA community to feel seen and heard as a result of properly aggregated data. Thank you for your consideration and time.
Thank you. Next caller.
Good morning, Madam Chair. This is Dora U.L. Martinez, D-R-A-U-C-H-E-L Martinez. I am representing the Nevada Disability Action Coalition, and I ditto the prior callers. As a Japanese student, Chairman, I think this is important to be included. Thank you to the sponsor, the brilliant Miller. Thank you. Have a good day.
Thank you. Next caller.
Chair, there are no additional callers to testify at this time.
Thank you so much. Then coming back to Carson City for testimony in opposition of Assembly Bill 139. If there's anyone here that would like to testify in opposition, I invite you to the table. Not seeing anyone. Is there anyone in Las Vegas that would like to testify in opposition of Assembly Bill 139? Not seeing anyone move to the table there. BPS, do we have anyone join us on the phone line that would like to testify in opposition of Assembly Bill 139?
If you would like to testify in opposition on Assembly Bill 139, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Then coming back to Carson City for neutral. If there's anyone that would like to provide neutral testimony on Assembly Bill 139, I invite you to the table. Not seeing any. Is there anyone there in Las Vegas that would like to provide neutral testimony on Assembly Bill 139? Not seeing anyone. Come to the table. BPS, do we have anyone on our phone line that would like to provide neutral testimony on Assembly Bill 139?
If you would like to testify neutral on Assembly Bill 139, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Well, as a sponsor, if you have any closing remarks before we close the hearing.
Thank you so much, Chair Monroe Moreno. I did get a message that one person got disconnected on the phone, but that is fine. With that, I just want to, my closing remarks are 2 points I want to make before and to follow up with what the doctor said. There was, but not as medically, there were two national research studies that were done or attempted last year. One was over the effects of Alzheimer's and the Arab community, and one was about COVID and its impact on the Arab community. But both of those studies found it challenging because, again, they didn't have the accurate statistical data. I'd also say something that pleases all of us Nevadans is we all want to be part of presidential primaries and position ourselves as one of the primary states. So again, this would help us recognizing our diversity. And again, one more reason why every presidential candidate should be visiting Nevada. And with that, I thank you for hearing and your consideration. Chair, I will get those emails or something to you today.
Thank you so much. And with that, we will close the hearing on Assembly Bill 139. Members, we'll go back to the top of our agenda and we'll open the hearing on Assembly Bill 137. This was an interim standing committee on Health and Human Services. Bill 137 revises provisions relating to fetal alcohol syndrome disorders. The bouncy chair. Good morning.
Good morning, Madam Chair and committee members. I am Sarah Peters. I represent Assembly District 24, and I had the privilege of being the chair of the Interim Health and Human Services Committee this last interim. Today, I will briefly present AB 137, which is a bill related to fetal alcohol spectrum disorder. Initially, this bill was designed to redefine fetal alcohol syndrome to mirror the federal designation of fetal alcohol spectrum disorder, which broadens the support services for those folks who are impacted. Let's see. Fiscal notes. We ended up revising the bill in the Health and Human Services Committee to ensure that it captured the types of services that, expanded services that people who are diagnosed with fetal alcohol spectrum disorder would require. This is what resulted in the fiscal notes. I believe there is a fiscal note from Medicaid. Due to this expansion of services. And in conversations with folks from Medicaid, this is a result of covering services, or the requirement to cover expanded services for folks who may or may not have received those services in other areas. I believe Medicaid is in the room if you would be interested in talking to them about their revised fiscal note.
Good morning. If there is someone from Medicaid that can speak to the fiscal note, I invite you to join Assemblywoman Peters at the table. Good morning.
Good morning, Madam
We
Chair.
seem to spend every day together.
Right. Medicaid. Good morning. Stacy Weeks for the record, committee members. Division of Healthcare Financing and Policy. Yes, we do have a fiscal note on this bill, and this bill specifically would be implementing a new Medicaid benefit that is used in other states but has not been used in Nevada. It allows us for a 90-10 FMAP, draws down quite a bit of federal share, so it's a really good program. It also, that share is in place for about 8 quarters. So for the first 2 years, it's a really reduced cost to the state. And this program allows us to cover a lot of services we do not cover now for providers who try to wrap around services for this population and try to help this population and their families keep their kids and adults in their home. It covers things like comprehensive care management, care coordination, health promotion, transitional care services, patient and family supports to individuals with fetal alcohol syndrome, as well as referrals to community and social supports. And it really is integrating that primary care and behavioral health services in the home setting and helping that multidisciplinary team come together to support that family and that individual. We believe that the cost of this program for the fiscal year 24-25 in terms of medical spend would be a total of $304,367. The state share, we did assume some savings for reduction in cost to residential treatment services by helping keeping families in their home. So the state general fund cost is $29,937. And that's just in the first 2 years. This program would also require additional staffing for the agency. So under federal law, it does require us to do a great deal of evaluation and quality metrics for these families that are served and providers serving them, which is a good thing, but we do need some staffing to do that work and to set up this new program. And so we are asking for 3 positions for a total of $452,033. The state share, though, we are able to draw down federal share for those positions, and the state share cost is $226,016. So the total computable, so federal and state share for the program is $825,840, and the state share cost is $290,674. And I will stop there for questions. And I apologize if I went really fast.
That's okay. So the total state share would be $290,674,
Madam Chair.
Perfect. Thank you for that. Members, any questions of the presenter or Ms. Weeks? Seeing none, and with this cost, would your division be able to absorb the cost, or would you need a general fund appropriation to cover that?
Madam Chair, committee member Stacy Weeks for the record, we would need the state share appropriation so we could draw down the federal funds.
Members, any questions? Seeing none, I thank you both for the presentation, and I'll just ask you to step back. And we'll invite anyone to the table that would like to testify in support of Assembly Bill 137. Good morning. They're all bounty seats this morning.
They are. Good morning, Madam Chair, members of the committee. Leah Case here today on behalf of the Children's Advocacy Alliance. This was a bill that we worked on in the Interim Health and Human Services Committee with Chair Peters, and just thrilled to see the amended version that includes the services. Initially we had thought it would just be the definition change with the hope that in the future we might be able to start drawing down some of those federal funds. So having the ability to do that now will provide so much more care to the people who need it in our state and will help prevent longer term costs in education, in the criminal justice division, things that we don't see in these fiscal notes because fiscal notes only talk about, one budget account. So consider that also when you're looking at this investment of $290 some odd thousand, that this will also impact positively some of our other accounts. Thank you so much.
Thank you. Is there anyone else here in Carson City that would like to testify in support of Assembly Bill 137? Seeing none, we'll go to Las Vegas. Good morning.
Good morning, Madam Chair and members of the committee. Stephen Cohen for the record. Stephen with a V. Cohen is in the Assemblywoman, no known relation. Ditto. Thank you, and I yield.
Good morning, and thank you for joining us. Not seeing anyone else in Las Vegas to testify in support. BPS, do we have anyone on the phone line that would like to testify in support of Assembly Bill 137?
If you would like to testify in support on Assembly Bill 137, please press star 9 now to take your place in the queue.
Dear Chairwoman and members of the committee, I'm a birth and postpartum doula serving the Reno, Carson City, and Lake Tahoe area. I'm currently in the process of enrolling as a Medicaid provider. It is a lengthy process that has taken a total of 5 months now. Yet I'm persevering in my enrollment because it is important to me that I'm able to serve the disadvantaged community that so desperately needs the support of doulas.
Thank you so much. Next caller.
Good morning, Madam Chair. It's me again, Dora O.L. Martinez, representing the Nevada Disability Action Coalition, and we thank the sponsor of this bill, and we urge you to please pass it. Thank you. Have a good day.
Thank you so much. Next caller.
Chair, there are no additional callers choosing to testify at this time.
Thank you. So coming back to Carson City, is there anyone here in Carson City that would like to testify in opposition of Assembly Bill 137? Not seeing any. Is there anyone in Las Vegas that would like to testify in opposition of Assembly Bill 137? Not seeing anyone come to the table. BPS, do we have anyone join us on the phone line that would like to testify in opposition of Assembly Bill 137?
If you would like to testify opposition on Assembly Bill 137, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. And coming back to Carson City for neutral testimony. If there's anyone here that would like to provide neutral testimony on Assembly Bill 137, I invite you to the table. Good morning.
Good morning, Chair Monroe Moreno and members of the committee. Joanna Jacob on behalf of Clark County. You may see that we had a narrative, a fiscal note that we put in the in the system, but I wanted to just speak briefly to that. Many of these children who are going to be served by this bill are in foster care in Clark County Child Welfare Services. The county works with the state. We are assessed for services on behalf of children who are also served by the Aging and Disability Services Division. We think this is a positive step, so though there may be impacts to our assessments for the children who are served, it will help additional families get care. And we can see this as a benefit, especially as we get our heads around this concept of fetal alcohol syndrome, because I know this is something that has been very much discussed between the people working on the children's behavioral health crisis in Southern Nevada. So we appreciate Medicaid's work and the work of Chair Peters and everybody who's involved. So we will work with the state on this, and I think it's a positive step. We're neutral because it may hit our assessments, but it'll help families get care. So we will just continue to work with the state agencies on this. Thank you very much.
Thank you so much. Is there anyone else here in Carson City that would like to provide neutral testimony? Not seeing any. Is there anyone in Las Vegas that would like to provide neutral testimony on Assembly Bill 137? Not seeing anyone. BPS, do we have anyone on the phone line that would like to provide neutral testimony on Assembly Bill 137?
If you would like to testify neutral on Assembly Bill 137, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. And we'll ask the presenter if you have any closing comments. Thank you. Members will be work sessioning this bill later today. And we'll close the hearing on Assembly Bill 137. And staying on the same subject matter, we'll open the hearing on Assembly Bill 422. And we'll invite Assemblywoman Gorlow to the table. 422. Good morning.
Good morning, Madam Chair and committee members. For the record, I am Assemblywoman Michelle Gorlow, and I'm here to present Assembly Bill 422. 422 has seen some changes, and I know there are some people in this committee that saw the original policy, so I just kind of want to touch base a little bit on it from its original conception, because the original bill that came out was wonderful. I heard a lot of wonderful feedback, but the reality was we were already doing it as a state. So, talked to the State Health Division, and we came up with this plan that we were going to the extent money's available, that's in the new amendment, that we'll do an evidence-based program that will support services for children diagnosed with fetal alcohol syndrome. And it will include training to providers so that we can increase our capacity and also build a workforce development for these children. So talk to the state, because we have changes so that as to the extent money is available, because I believe there's federal funding available, our fiscal note should be removed. And with that, I will invite the state to come up to talk about the fiscal note.
Thank you so much. So we have a fiscal note that was submitted by the Aging and Disability Services. If you're in the room and can speak to that fiscal note, that would be wonderful.
Good morning, Madam Chair and members of the committee. Ricky Robb, Aging and Disability Services Deputy Administrator. With this proposed amendment, we will be able to remove the fiscal note, and in the hopes to find additional funding to be able to provide the pilot.
So the fiscal note would go to zero?
Ricky Robb, for the record, yes, ma'am.
We like zero. Thank you. Members, any questions for the presenter or for the representative from DHHS? Not seeing any. Thank you so much. We'll ask you just to step back, and we'll invite anyone to the table that would like to testify in support of Assembly Bill 422.
Good morning, Madam Chair. Leah Case again on behalf of the Children's Advocacy Alliance in support of Assembly Bill 422. We realize that there may not be money available yet for this pilot program, but like our enthusiastic support of AB 137, this is a necessary step in providing the needed care in Nevada to children, especially born with fetal alcohol spectrum disorder. There is a huge gap in care for this population, and so anything we can do to bridge that gap is important. Thank you so much.
Thank you. Is there anyone else that would like to testify in support of Assembly Bill 422? Not seeing any here in Carson City. We'll go to Las Vegas.
Good morning, Madam Chair and members of the committee. Stephen Cohen again. For the record, Stephen with a V. Cohen as in the Assemblywoman, no known relation. Ditto. Thank you, and I yield.
Thank you so much. BPS, do we have anyone joining us on the phone line that would like to testify in support of Assembly Bill 422?
If you would like to testify in support on Assembly Bill 422, please press star 9 now to take your place in the queue. Chair, there are no.
Good morning, Madam Chair and all of the committees. This is Dora U.L. Martinez representing the Nevada Disability Action Coalition. Many thanks to the sponsor of the bill. We urge you all to please pass this common sense bill. Thank you.
Thank you so much. BPS, do we have any other callers?
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. Coming back to Carson City, do we have anyone here in the audience that would like to testify in opposition of Assembly Bill 422? Not seeing any. Is there anyone in Las Vegas that would like to testify in opposition of Assembly Bill 422? Not seeing any. BPS, do we have anyone on the phone line that would like to testify in opposition of Assembly Bill 422?
If you would like to testify in opposition on Assembly Bill 422, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. So coming back to Carson City and going to the neutral position, is there anyone that would like to provide neutral testimony on Assembly Bill 422? Not seeing any, and not seeing anyone come to the table in Las Vegas. BPS, do we have anyone on the phone line that would like to provide neutral testimony on Assembly Bill 422?
If you would like to testify neutral on Assembly Bill 422, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you. Then we'll ask the presenter if you have any closing comments for Assembly Bill 422. All right, seeing none, we will close the hearing on Assembly Bill 422, and members will be work sessioning this bill later today. Assemblywoman Taylor, which bill are you here for? Okay, then we'll open the hearing on Assembly Bill 434. Assembly Bill 434 revises provisions governing prescription drugs. Good morning.
Good morning. Thank you, Madam Chair. Thank you for recognizing that I wasn't just here to visit. My name is Angie Taylor, and I'm the proud Assemblywoman from District 27 in Northern Nevada by the University. And I am here we are here to present Assembly Bill 434. And again, just thank you for this opportunity, and thank you for the quick turnaround. I know I was up late with you, but you were here. And I was at home, so I appreciate that service. Just in a nutshell, what the bill does. There are community health centers that we all have in our communities, primarily Clark County, Washoe County. There are a few others, and they're known as FQHCs, Federally Qualified Health Centers. And they can get a very large discount because of the 340B program on prescription drugs. But they can get reimbursed from insurance company at the retail rate. And these community-based health centers use the savings to provide health care services and other medical needs for more of the underserved community. The savings are used to fund those other programs. And this bill, Assembly Bill 434, prohibits insurers and pharmacy benefit providers from keeping some of those savings by not passing them on. And that's what this bill is all about, to continue. Right now, the status quo is that gets passed on, but there's been some complications of late of those third parties keeping that money, and we want to make sure that continues to get passed along to those FQHCs. On to the fiscal note. The fiscal note was added after the policy hearing on April 12th, and it was to cover a potential fiscal impact to Medicaid. Since then, an amendment, which is on Nellis, and you should all have that before you, has been, we've submitted an amendment which removed the potential impact, and so Medicaid has since removed the fiscal note. And your good friend, Madam Chair Stacey Weeks, because you said you've been hanging out, is here from Medicaid, and she's certainly able to answer any questions regarding the fiscal note. And then also Steve Messenger here from the Nevada Primary Care Association is here to walk you through the bill if you so desire, or to answer any other questions.
Thank you so much. No, we will not need to walk through the bill, but the amendment that was provided, this was not amended in the policy hearing.
Correct.
So it's going to be amended here,
Yes.
and that has a direct effect on the fiscal note.
It should remove the
So
fiscal
we'll have to amend, okay?
Yes. Thank you, Madam Chair.
And
Yes.
then if we could add my new friend, Ms. Weeks, to the table to come up and testify on the fiscal note that had been.
Good morning, Madam Chair, committee members. Stacey Weeks for the record, Division of Healthcare Financing and Policy. Yes, this fiscal note does address our fiscal impact, so we can remove it. So it's 0.
Perfect. We love zeros. Members, any questions for the presenter? All right. If we have someone from Public and Behavioral Health in the audience, that would be great. The fiscal note that was submitted from you said you could not determine fiscal impact. Can you add anything to that? Good morning. My other best friend this session.
Good morning, Chairman Monroe Moreno, Cody Finney from Public and Behavioral Health for the record. Yes, we did have a fiscal note that indicated a $0 but could not be determined because of the complicated mechanism by which some of this money gets passed around. It's possible that we could perhaps quantify that better in a future legislative session, but at this time we don't have concerns.
Thank you so much for that. Members, any questions? All right, not seeing any. Well, thank you so much. We'll ask you to go ahead and step back. And we'll invite anyone to the table that'd like to testify in support of Assembly Bill 434. Good morning.
Good morning, Madam Chair, members of the committee. My name is Helen Foley, and today I am representing the Medicaid Managed Care organizations in Nevada, which are Health Plan of Nevada, Silver Summit, Molina, and Anthem. And because of the amendment that came forward from Assemblywoman Angie Taylor, the work of the Primary Care Association, and also Stacey Weeks, we are very happy to lend our support to this legislation. So thank you very much. We think that it will work very well with us, but also with our relationship with the FQHCs in Nevada.
Thank you so much. Good morning.
Good morning. Thank you, Madam Chair. Susan Fisher with McDonald-Carano. For the record, speaking this morning on behalf of Northern Nevada Hopes, a nonprofit clinic in Reno that serves the underserved population, and this bill will go a very long way in ensuring that they're able to continue to receive the pharmaceutical rebates to help them serve the community in Reno. Thank you.
Thank you. Good morning.
Good morning, Madam Chair, members of the committee. Joan Hall, representing Nevada Rural Hospital Partners. Our critical access hospitals and RHCs also benefit from this program. We're in support. Thank you.
Thank you. Is there anyone else here in Carson City that would like to testify in support of Assembly Bill 434? Not seeing any. Going to Las Vegas. Is there anyone there in Las Vegas that would like to testify in support of Assembly Bill 434? Not seeing anyone come to the table. BPS, do we have anyone on the phone line that would like to testify in support of Assembly Bill 434?
If you would like to testify in support of Assembly Bill 434, please press star 9 now to take your place in the queue.
Good morning, Madam Chair. This is Dora U.L. Martinez representing the Nevada Disability Peer Action Coalition. I am the constituent of Auntie Taylor, and we appreciate this bill. Some of my members go to the Northern Nevada Hope Clinic, one of the excellent Hope Clinic in the state. So please, we urge you to support it. Thank you.
Thank you. Next caller.
Good morning. For the record, this is Adam Porath, P-O-R-A-T-H, representing the Nevada Society of Health System Pharmacists. I work at a disproportionate share hospital that would benefit from this, and it will continue to provide access to our patients. We are strongly supportive of this bill. Thank you.
Thank you. Next caller.
Good morning, Madam Chair and members of the committee. This is Sarah Adler with Silver State Government Relations. Today, joining in support for First Med, which is an FQHC with 3 locations in Clark County. They utilize these rebate funds to fill gaps and extend services to homeless individuals, foster youth, and many more. We thank you and urge your support.
Thank you. Next caller.
There are no additional callers choosing to testify at this time.
Thank you so much. Then coming back to Carson City, and we'll open opposition. Is there anyone here in Carson City that would like to provide testimony in opposition of Assembly Bill 434? Not seeing any. Is there anyone in Las Vegas that would like to provide testimony in opposition of Assembly Bill 434? Not seeing anyone come to the table there. BPS, do we have anyone on our phone line that would like to provide testimony in opposition of Assembly Bill 434?
If you would like to testify in opposition on Assembly Bill 434, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Coming back to Carson City, is there anyone that would like to provide neutral testimony on Assembly Bill 434? Not seeing any, and not seeing anyone come to the table in Las Vegas. BPS, do we have anyone on the phone line that would like to provide neutral testimony on Assembly Bill 434?
If you would like to testify neutral on Assembly Bill 434, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. And we'll ask the presenter of the bill if you have any closing comments. All right, thank you for that. Members, another bill will be work sessioning later today, and we'll close the hearing on Assembly Bill 434. The next bill that we will be hearing will be Assembly Bill 252, and we'll invite Assemblywoman Cohen to the table, and she has two bills before us this morning, members. So after 252, we'll be going to Assembly Bill 255. Good morning and welcome.
Good morning. Thank you, Chair and Committee. I'm Leslie Cohen, representing Assembly District 29, starting with AB 252. This legislation has to do with making our state museums more accessible for disabled Nevadans and visitors. So the section where the fiscal note comes in is Section 3, Sub 2, which has to do with remediating the websites for the museums. And I had hoped that Enterprise IT Services could help with that, but from what I've been told, they can't because the websites were done by a third-party vendor. So basically, we're at the point where the fiscal pretty much is what it is, which is a $25,000 fiscal to get those websites up to date. I will note that it has been well more than 30 years since the Americans with Disabilities Act has been passed, and we really should have those websites be accessible to everyone. And if they're not, we risk lawsuits. We risk, it's just something where this should be taken care of. It's the right thing to do, but it's also the fiscally responsible thing to do to get this issue resolved so that everyone can take advantage of the websites and our museums in the state. So with that, I'm available for questions.
Thank you so much. Before we go to questions from the members, is there someone here from the Department of Tourism and Cultural Affairs that can speak to the fiscal note? Good morning. I see that it's just a one-time fee amount that would be needed in FY24. My question for you is, I understand that seems like every website and software needs to be updated in the state of Nevada, but how long would it take to get the process completed?
Good morning, Madam Chair. Good morning, Committee. Myron Friedman, Administrator, Division of Museums and History, for the record. I don't have a solid time frame for you. I can get that information. We do work with a contractor. The contractor is currently on board, so we won't waste any time having to find one. So I could probably get an answer to you within a few days.
Perfect. And the appropriation that would be needed is the $25,000, correct?
Myron Freeman, for the record, yes, Chair.
Thank you. Members, questions for the presenter or from the Cultural Affairs? Any questions? Assemblywoman Peters?
Thank you, Madam Chair. So we've seen a lot of stuff going on in this building in the last couple of weeks, so I may be misremembering this. But we talked about language access planning, and I believe that we funded a bill on language access planning, right? And in that bill, do you guys have a language access plan to incorporate language access for the blind and deaf?
Myron Freeman, for the record. So that would be part of the study we would be conducting, as the bill points out. And we don't have that currently, so we would be talking with committees, getting the input we need to determine exactly what we need to do.
Okay, so your office is not already covered under the language access work that has been done at the executive level?
Myron Freeman, for the record, not to my knowledge.
Okay, thank you.
Members, any other questions? All right, not seeing any. Thank you so much. We'll ask you both to go ahead and take a seat, and we'll invite to the table anyone that's here to testify in support of Assembly Bill 252. Good morning.
Good morning, Chair and members of the committee. My name is Catherine Nielsen. I'm the Executive Director of the Nevada Governor's Council on Developmental Disabilities. We've sent in comments, but I just want to reiterate that we would like to work with the bill sponsor and the Department of Museums and everybody that's really responsible for these websites to ensure that they are accessible and running as appropriate. And we just want to highlight the fact that, obviously a lawsuit for not having an accessible website would create a much bigger fiscal impact to these agencies than the $25,000 to update the websites. And the main thing is to obviously make the changes now and ensure that going forward, whatever you put on that site is accessible. And so we obviously have made a commitment to work with these agencies to ensure that that happens regardless. Thank you.
Thank you. Good morning.
Good morning, Chair and Committee. My name is Kira Capurro, spelled K-I-E-R-R-A-C-A-P-U-R-R-O, representing McDonald Carano on behalf of the Nevada Blind Children's Foundation. We support the bill. Thank you.
Thank you. Is there anyone else here in Carson City that would like to testify in support? Not seeing any. Going to Las Vegas. Good morning.
Good morning, Madam Chair, members of the committee. Stephen Cohen for the record. Ditto. Thank you, and I yield.
Thank you. Not seeing anyone else at the table in Las Vegas. BPS, do we have anyone join us on the phone line that would like to provide testimony in support of Assembly Bill 252?
If you would like to testify in support of Assembly Bill 252, please press star 9 now to take your place in the queue.
Good morning, Madam Chair. This is Dora L. Martinez representing the Nevada Disability Peer Action Coalition and the Nevada Council of the Blind. My apologies, we were supposed to get there this morning, but I'm dealing with a minor migraine. But I would like to thank the awesome, fantastic, one-of-a-kind Leslie Cohen for sponsoring this bill. It is really a long overdue. This will benefit everybody's needs, and especially the K-12 students. I remember taking my daughter when she was 6 to the museum, and she ended up explaining things, and I felt very discouraged. And I hope that you all pass this bill, and we are willing to work. We look forward to work with the director, Mr. Friedman, and hopefully that he will keep that in mind when he's building the Boulder City Museum to be more accessible and have a universal design in mind. Thank you and have a great day.
Thank you. Next caller.
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. So coming back to Carson City, we will go to opposition. If there's anyone here in the in the audience that would like to provide testimony in opposition of Assembly Bill 252, I invite you to the table. Not seeing anyone. And not seeing anyone at our table in Las Vegas. BPS, do we have anyone on the phone line that would like to provide testimony in opposition of Assembly Bill 252?
If you would like to testify in opposition to Assembly Bill 252, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Coming back to Carson City. Is there anyone here that would like to provide neutral testimony on Assembly Bill 252? Not seeing any. Is there anyone at the table in Las Vegas? Not seeing anyone at the table in Las Vegas. BPS, do we have anyone on the phone line that would like to provide a neutral testimony on Assembly Bill 252?
If you would like to testify neutral on Assembly Bill 252, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. And we'll ask the bill sponsor if you have any closing remarks on this one. Thank you so much. And we're going to do a little more research into that $25,000, but if we can get our questions answered, we will be work sessioning that bill later today. And with that, we will close the hearing on Assembly Bill 252, and we will open the hearing on Assembly Bill 255. Good morning.
Good morning. Thank you again. Leslie Cohen, Assembly District 29, here to present AB 255. And just here's some basic information about the Adoption Assistance Program, which is the subject of AB 255. It's the Adoption Assistance Program was enacted in accordance with the Child Welfare Assistance Act of 1980. The subsidy encourages and supports families in adopting children with special needs from foster care by enabling families to adopt without placing an undue financial burden on the families. It provides a subsidy based on the child's special needs rather than the adoptive family's income. The child is in the custody of a child welfare agency or Nevada licensed child placing agency through termination of parental rights and or a relinquishment for 6 months. And there was an effort made to locate an adoptive family who could adopt without the subsidy assistance. The child meets the following requirements: not yet 18, cannot or should not be returned to the birth parents, excuse me, or meets one of the criteria for special needs. The monthly adoption assistance payments may be negotiated up to but not exceed the monthly foster care maintenance rates. So what the bill does is really simple. Currently, an agency which provides child welfare services may provide financial assistance to a family that adopts a child with special needs until the child attains the age of majority, becomes self-sustaining, is emancipated, or dies, whichever occurs first. And so what the bill would do would allow the subsidy to continue out until the child A, reaches 18 years of age if the child is not enrolled in school, or 19 years of age if the child is enrolled in school, B, graduates from high school if the child is at least 18 years of age, C, becomes self-supporting, D, is emancipated, or E, dies. So basically what we're doing is extending this out. So instead of cutting the subsidy off when the child turns 18, we're allowing the child to graduate from high school, hopefully, at least get them until they're 19 years old, if they haven't already graduated from high school. And the language mirrors the language of our child support statute. And so in my practice as a family law attorney, I've always assumed that the child support language was this way because we acknowledge that a high school student who turns 18 is not automatically self-supporting. The student is still living at home and going to school, and that's why child support continues generally until they graduate. So at the hearing, in the policy hearing, we heard testimony about the importance of getting these kids, just getting them through high school. And if the subsidy cuts off before graduation, some of these families may be looking to the child to go to work to help supplement the income for the family. But for these families and for these children who have special needs, just graduating is what's most important. We need to get them through graduation. And I think what we need to be clear about with this subsidy is that these children, once they're adopted, they're fully adopted, and their parents have the rights and responsibility of parents that all parents have in raising their children. But at the same time, we shouldn't forget that at some time in these children's lives, these children were the responsibility of the state. These adoptive families made their families whole by adopting these children, but these families also took a financial responsibility that the state would have otherwise been required to bear, and took that responsibility on for the family. So I'm available for questions at this point. I'm not sure if anyone's here from the agency, or from the state, but the fiscal it's a really hard fiscal to wrap your head around, because what we're talking about is each year it's going to fluctuate, because we're talking about a different number of children, and some are going to graduate or some are going to turn 18 at different times during the year. So my understanding is the fiscal is based on this next year. It's an estimation. You also don't know if children are going to move, that type of thing, but it's based on the next, or I guess this upcoming biennium, based on the children that we have, the birthdays and the estimated graduation dates of the children that are currently in the program. And with that, I'm available for questions.
Thank you. I do have a question. This bill was amended in the policy committee, and I'm looking at that amendment, and it simply added co-sponsors. Were there any other amendments to the actual policy part of the bill?
Leslie Cohen, Assembly District 29.
to the, not that I recall, that was so long ago. Sorry, Chair, that feels like that was 3 years ago. But no, I believe we just added on co-sponsors, but I can double check that while you're going through support and opposition. I'll double check.
Thank you so much for that. Then I will ask the Child and Family Services to come up just to address their fiscal note. Good morning. There was a fiscal note that was submitted on March 22nd that had an FY24 $136,954 and an FY25 $161,747. But then that was amended on April 24th with the reprint that added a huge amount. Could you explain why, if there was only co-sponsors put on with the amendment, why did the fiscal note go up so high? Because it's at $1,750,997 in FY24 and $1,978,000 in '25.
Good morning, Melanie Young, Deputy Administrator for the Division of Child and Family Services. For the record, when we originally submitted the fiscal note, we submitted it only for the rural region. In reviewing the bill later on during the session, we realized that Washoe County and Clark County, who also have adoptive youth through their child welfare agencies that the state funds, that their fiscal notes referenced back to that it's the state's responsibility for the adoption. So we amended the fiscal note to be accurate to the fiscal impact. So the fiscal impact is in fiscal year 2024 anticipated to be $1,750,997. Of that, $733,450 is general fund. In fiscal year 2025, the fiscal impact is expected to be $1,978,568, with the general fund impact being $855,187. The rest of it is funded with federal Title 4E, which the state, when we expend general fund dollars, we earn 4E dollars. So we would have to spend the dollars to earn that.
Perfect. That explains a lot. And could you just give me the numbers for FY24? It's 733,000 and what's the?
733, again, Melanie Young, for the record, $733,450.
Perfect. Thank you. Members, any other questions? Not seeing any. Thank you so much. We'll invite anyone to the table that would like to testify in support of Assembly Bill 255. I'm not seeing anyone come to the table here in Carson City. We'll go to Las Vegas.
Good morning, Madam Chair, members of the committee. Stephen Cohen for the record. Ditto, thank you, and I yield 4 down, 3 to go.
Thank you so much. Not seeing anyone else at the table in Las Vegas, BPS will go to the phone line. Do we have anyone joining us by phone that would like to testify in support of Assembly Bill 255?
If you would like to testify in support of Assembly Bill 255, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Coming back to Carson City, do we have anyone here that would like to testify in opposition of Assembly Bill 255? Not seeing any, and not seeing anyone come to the table in Las Vegas, BPS. Do we have anyone on the phone line that would like to testify in opposition on Assembly Bill 255?
If you would like to testify in opposition on Assembly Bill 255, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Moving to the neutral position, is there anyone here in Carson City that would like to provide neutral testimony on Assembly Bill 255? Not seeing any. Not seeing anyone at our table in Las Vegas. BPS, do we have anyone on the phone that would like to provide neutral testimony on Assembly Bill 255?
If you would like to testify neutral on Assembly Bill 255, please press star 9 now to take your place in the queue.
Good morning, Madam Chair. This is Dora L. Martinez representing the Nevada Disability Action Coalition. Madam Chair, I'm so sorry. I was trying to call in support. I wasn't in time. If you could just move my testimony to support. We wholeheartedly support this common sense bill, and we thank the sponsor for introducing it. Thank you.
Thank you, and we will move your testimony to the support column. BPS, do we have any other callers on the line that would like to provide neutral testimony on Assembly Bill 255?
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. We'll ask the sponsor if you have any closing comments.
Leslie Cohen, Assembly District 29. Thank you for hearing both of my bills today. And I'll reiterate, I think, what Ms. Uel Martinez said. This is really common sense. These are children that it's the duty of the state to care for these children. The families took these children in with the state saying we would help to continue to support these children because of their special needs. And we all know that you don't turn 18 when you're in the middle of your senior year of high school and all of a sudden you're self-supportive. So we want to keep these kids in high school, allow them to graduate so that they can go on to have productive adult lives, but they're in that gray area where, you know, they're still kids, they're still in our homes, they're still our kids, and so we do need to continue to support them, and I'll leave it at that. Thank you very much.
Thank you so much. And members, for the clarifications on the fiscal notes associated with this bill, we will be able to work session this bill later today. And with that, we close the hearing on Assembly Bill 255. All right. Going back towards the top of our agenda, we will open the hearing on Assembly Bill 201. 201 revises provisions relating to the planning for the provisions of behavioral health care. And we'll welcome back to the table Assemblywoman Peters.
Thank you, Madam Chair. Thanks for having me back again. I'm Sarah Peters. I represent Assembly District 24, and I'm presenting Assembly Bill 201 to the Ways and Means Committee today, which is another interim standing committee, interim joint standing committee bill for Health and Human Services. Briefly, this bill asks to quantify and report on spending and savings in the children's behavioral health system of care. It also requires presentation and reporting of findings to the Interim Joint Health and Human Services Committee and a final report of its findings to the Ways and Means Committee prior to the next legislative session. It also defines children's behavioral health system of care and establishes a statewide mental health consortia and membership of the Subcommittee on Children's Behavioral Health of the Commission on Behavioral Health. I believe all fiscal notes have been removed. If there are any questions, I will stand for them.
There were quite a few fiscal notes. Trying to get all the original fiscal notes with the ones that have been removed. I'm not sure how you did that, but you got them all down to a 0. Since we do have it all in writing, I will not need the agency to come up and testify to their fiscal notes because we do have them here. Members, any questions to the presenter on this piece of legislation? Assemblywoman Dickman.
Thank you, Madam Chair. Does this remove the 2/3 as well?
Sarah Peters for the record. On the first reprint, there is no
Oh, there is
2/3.
no 2/3. Thank you.
Yeah.
Sorry. Thanks, Chair.
And for the record, I'm not sure I clarified this. The intent of this bill is really to be able to quantify where cost savings are found due to our investment in the children's behavioral health system of care and be able to justify reinvesting that in, so we create a model where all those cost savings go back into matching dollars or to support systems that we know work and can quantify those systems that work. This is a project that these agencies should be doing anyways, right? When they're seeing how those investment models work and when they're looking at what is of value to the populations they serve, which is part of why we were able to get those fiscal notes down to 0.
Perfect. See no other questions, I'll ask you to go ahead and take a seat back, and we'll invite to the table anyone that's here that would like to testify in support of Assembly Bill 201. Not seeing anyone here in Carson City, we'll go to Las Vegas.
Good morning, Madam Chair, members of the committee. Stephen Cohen for the record. Ditto, thank you, and I yield.
Thank you so much. BPS, do we have anyone on the phone line that would like to testify in support of Assembly Bill 201?
If you would like to testify in support of Assembly Bill 201, please press *9 now to take your place in the queue.
Good morning, Madam Chair. This is Dora Oil Martinez, representing the Nevada Disability Action Coalition. We'd like to thank the sponsor of this common sense bill, and we urge your support. Thank you.
Thank you. Next caller.
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. So we'll move to opposition. Is there anyone here in Carson City that would like to provide testimony in opposition of Assembly Bill 201? Not seeing any. Not seeing anyone move to the table in Las Vegas to provide testimony in opposition. We will go to the phone lines. BPS, do we have anyone join us on the phone line that would like to testify in opposition of Assembly Bill 201?
If you would like to testify in opposition to Assembly Bill 201, please press *9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Then we will go to neutral. If there's anyone here in Carson City that would like to provide neutral testimony on Assembly Bill 201, I invite you to the table. Not seeing any, and not seeing anyone move to the table in Las Vegas. BPS, do we have anyone on the phone line that would like to provide neutral testimony on Assembly Bill 201?
If you would like to testify neutral on Assembly Bill 201, please press *9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Then we'll ask the bill sponsor for closing comments, and there are not any members. We will be able to work session this bill later today, and with that, we will close the hearing on Assembly Bill 201. And we will open the hearing on Assembly Bill 259. Assembly Bill 259 revises provisions governing wages for persons with disabilities, and we invite Assemblywoman Brown May to the table.
Thank you, Chair, members of the committee. Tracy Brown May for the record, proudly representing Assembly District 42. This bill is an excellent policy. Thank you. It is the result of a lot of very dedicated work throughout the interim and actually probably the last 10 years. It transitions people with developmental disabilities away from sub-minimum wages. It ceases the sub-minimum wage certificates from being recognized in the state of Nevada. And it moves people with disabilities into benefits planning to help them consider competitive integrated employment where they can earn a competitive wage and receive benefits. Those folks are currently served under the Medicaid ID waiver and are in sheltered workshops, day hab settings, and not currently considering employment. The fiscal note in this bill is specific to a new service being added to the Medicaid ID waiver, which helps individuals with disabilities consider competitive integrated employment. That's where the fiscal note comes from. It's not a current service that's provided in our Medicaid waiver currently. So it is a federal state match. The fiscal note identified by the division, and we have an awesome dream team here from the Division of Aging and Disability Services to talk through the fiscals. The data that I received from the division identify currently there are 2,221 people on the ID waiver that would be eligible for this service. For it to be included in the waiver, it has to include everyone. So everyone on the waiver would have access to this support service. The total cost is $1,066,080. But the state general fund match for the total of 2,221 people is $395,728.90. And that is for beginning this January 1, 2025 as written in the bill. So if we start this service in the waiver effective January 1, 2025, the state general fund portion would be $395,728.90 to serve all 2,221 people. Now, there are a couple of considerations there. We don't currently have capacity in the state to do benefits planning. We don't have providers to deliver the service. So the dollar implication would not be at 100% of what the appropriation is requested by the state. So we would need time to ramp up to that 100% capacity. And the Department of Employment Training and Rehabilitation, the Division of Vocational Rehabilitation Services, noted in their budget closing that they are launching a benefits planning website, which could also provide assistance to this population if they have an open voc rehab case. So there's some duplicative effort that could be there, which would additionally decrease the actual costs associated with this service. I'm happy to stand for questions.
Thank you, members. Any questions? Not seeing any. If we can have the Aging and Disability Service come up just to confirm the dollar amounts. Good morning. We have your fiscal note in front of us, and in the testimony, Assemblywoman Brown May spoke about the federal match, so could you just let us know what the federal dollars are and the state dollars? That would be general fund dollars.
Ellen Cresilius, Deputy Administrator, Aging and Disability Services. The state general fund portion would be $395,729, and I didn't do the math to subtract that from the total, so I can't do math at the table.
And so the total was the $1,066,000?
Yes, $1,066,080.
Perfect. And is your division able to absorb those dollars, or would you need the general fund appropriation?
Good morning. For the record, Jennifer Frischman, Quality Assurance Manager for Aging and Disability Services. We would need the appropriation.
Thank you so much. Members, any questions for the Assemblywoman or the agency? Seeing none. Thank you so much, and thank you so much for the clarification on the general fund dollars that would be needed to stand up this program. If we have anyone here in the audience that would like to testify in support of Assembly Bill 259, I invite you to the table. Good morning.
Okay, good morning again, Chair and members of the committee. Catherine Nielsen, Executive Director of the Nevada Governor's Council on Developmental Disabilities. And I would argue that this is probably one of the most important bills that I'll be testifying on this session. So working age people with developmental and other disabilities are among the most unemployed and underemployed segments of our society. Too often, unemployment is often accepted as an inevitable result of living with a significant developmental disability. Employment is the avenue to independence and increased socialization for individuals with developmental disabilities. And all people, including those with disabilities, have a right to be in the competitive employment and in an integrated workforce. Our council believes that individuals with IDD who can and want to work should have access to the resources and support necessary to gain and maintain meaningful community-based employment being paid above minimum wage. In Nevada, we have at least, you heard, 2,221 people who are eligible to be paid sub-minimum wage. When we talk about sub-minimum wage, we're talking pennies. Pennies for the same work that people without disabilities would be paid at least minimum wage to do. And the Association for Persons in Supported Employment, or APSE, has determined that while subminimum wage may have at one time been a valid and effective strategy for enhancing the employment of people with disabilities, the evolution in the disability rights and community employment makes subminimum wage no longer necessary or acceptable. And we understand the work it takes to eliminate subminimum wage is a huge lift and a huge ask, but it's necessary. And phase out of subminimum wage needs to occur over a period of time, as identified in the bill language, to ensure that we do not eliminate options and choice for those with disabilities who are currently employed. Nevada must join a national effort to improve the overall quality of community employment outcomes, both in terms of individual outcomes, wages, hours, diversity of employment, and systems outcomes. And we greatly, greatly thank the bill sponsor for her work. Thank you.
Thank you. Go ahead.
Good morning, Chair and members of the committee. My name is Daniel Stewart. Today I'm testifying on behalf of the State of Nevada Association of Providers, otherwise known as SNAP. Currently, I believe SNAP is the largest coalition of groups and providers providing services to adults and children with disabilities. SNAP is in strong support of this bill. And would very much like to thank the sponsor. One of the real benefits of a citizenship or a citizen legislature is you get people with real subject matter expertise, and SNAP has worked with the sponsor probably over a decade now and to develop policy, and we urge your support. Thank you.
Thank you. Go ahead.
Thank you, Madam Chair and members of the committee. For the record, my name is Mary Przenski, here also representing SNAP. Lots of representation today, but in talking with several of the members of SNAP, they are very much in support of this, and so I just wanted to reiterate that this morning. Thank you.
Thank you. Is there anyone else here in Carson City that would like to testify in support of Assembly Bill 259? Not seeing any. Going to Las Vegas.
Good morning, Madam Chair, members of the committee. Stephen Cohen for the record. Stephen with a V. Cohen as in the Assemblywoman, no known relation. Ditto. Thank you, and I yield.
Thank you so much. Not seeing anyone else there in Las Vegas to testify in support of Assembly Bill 259. BPS, do we have anyone join us on the phone line that would like to provide testimony in support of Assembly Bill 259?
If you would like to testify in support of Assembly Bill 259, please press star 9 now to take your place in the queue.
Good morning, Madam Chair and members of the committee. For the record, my name is Ashley Cooper, ASHLEECOOPER. I am the Manager of Advocacy and Government Affairs at Opportunity Village. We are also a member of SNAP, I'll add. We're a Nevada nonprofit that employs, empowers, and serves people with disabilities. We're really pleased to support this thoughtful bill to provide better options and outcomes for people with disabilities, and also thank the sponsor.
Thank you. Next caller.
Hello. For the record, my name is Jolina Simpson, JOLLINA SIMPSON, with Make It Work Nevada, a nonprofit that works on the pocketbook issues of Black families in Southern Nevada. We wholeheartedly support this bill as it leads to a path of independence and autonomy. Thank you.
Thank you. Next caller.
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. Then we will move to opposition. Is there anyone here in Carson City that would like to provide testimony in opposition of Assembly Bill 259? Not seeing any, and not seeing anyone at our table in Las Vegas. BPS, do we have anyone on our telephone line that would like to testify in opposition of Assembly Bill 259?
If you would like to testify in opposition to Assembly Bill 259, please press star 9 now to take your place in the queue.
Madam Chair, this is Dora Martinez. I'm sorry I missed the call. Can I please proceed with my support testimony? I'm very sorry.
That is okay. We will move your testimony to support.
Okay, thank you. So Dora Martinez, representing the Nevada Disability Action Coalition. Please, we thank the sponsor of the bill, and this is about time. I mean, this happened in the 1930s during the Roosevelt era, and now it's 2023, and home means Nevada is home for all. And I know that you guys, you all want to be included. So please support this bill, and thank you. Have a good day.
Thank you. Next caller.
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. So we will move to neutral. If there's anyone here in Carson City that would like to provide neutral testimony on Assembly Bill 259, I invite you to the table. Not seeing any, and not seeing anyone at our table in Las Vegas. BPS, do we have anyone joining us on the phone line?
If you would like to testify neutral on Assembly Bill 259, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. We'll ask the presenter if you have any closing remarks. Seeing none, we will close the hearing on Assembly Bill 259, and we will work session that one later today. And with that, we will open the hearing on Assembly Bill 283, which makes changes relating to doula services, and will invite Assemblywoman Summers Armstrong to the table. Ease down on that bouncy chair. Good morning.
Good morning, Madam Chair and members of the Ways and Means Committee. You know, I often say that we work super hard in judiciary, but my goodness, I'm not sure that anybody can compete with what you all do during the session. And I'm grateful that you are making time today to hear what I believe is a very important bill, AB 283. Last session, we brought a bill, community-based bill, with Make It Work Nevada and the doulas of Northern Nevada and Southern Nevada to bring within the realm of services available for birthing families, doula services, which we know helps by no less than 4% reduce the rates of maternal mortality and illness with newborn babies. This session, I am back with the same group of supporters to talk to you about how we can better induce doulas to sign up with equitable pay. We know that most of these doulas are women. Quite a few of them are women of color. And this work is critical to our communities for our health purposes. We know that Black women have some of the highest rates of maternal mortality throughout the nation, no matter what your income, no matter what your socioeconomic status, no matter what your education. We believe that doula services help improve the outcomes, that after a birth of a child, that mom will come home with that baby. With me today is Jolena Simpson of Make It Work Nevada. I'm going to turn this over to her, and she's going to give you a short presentation. Thank you for your indulgence.
Thank you so much, and thank you for joining us. We will not need the PowerPoint. If you could just do the highlights and adjust the fiscal notes, that would be great. Thank you.
Thank you, Madam Chair. This is Jolena Simpson, for the record, JOLLINA SIMPSON. The highlights for this bill is with the second fiscal note. It really is important to incentivize doulas to be able to come onto the rolls. Doulas are trained and recognized for the physiological process of pregnancy, labor, and birth, and the postpartum period. Under current Medicaid laws, doulas are able to support their clients for 2 to 3 prenatals, continuous labor support during birth, which on average is about 17 hours straight work, and 2 to 3 postpartum visits. Currently, the total reimbursement for those services is $450. Across the nation, legislature has been passed to bring doulas up to a living wage, and that average is around $1,200. We modeled our bill after Rhode Island because of the similar populations that are on Medicaid, and then we came up with the increase at $1,500 with an additional 10% for doulas serving in rural environments because of the very specific needs of rural communities, including medical deserts and distances drive to get to additional care. Currently, doulas can reduce the amount of cesareans, and the cost between a cesarean and a vaginal birth is about $3,000 to $5,000. So that's a big win for doula support in the cost window. One more thing I would like to say is that since we started the initiation of bringing this reimbursement bill to the front, we've had more doulas finish in the pipeline than when we started. So at the beginning of this process, we had 3, now we have 6. Knowing that it takes doulas 3 to 6 months to get through this process, we are extremely pleased with how the pipeline is now filling up, since doulas know they will be able to hone their craft and be able to work in the communities that they live in and serve the communities that reach out to us all the time with need. And now we can wholeheartedly be able to not only feed our families, but feed our communities with our support. And finally, since our illustrious sponsor brought up our Nevada statistics, I just want to throw out there a few things that it's important to understand. In the rural regions, only about 6% of OBGYNs serve that region. That means there are a lot of families out there who need access to resources and support that doulas can help provide. Large portions of rural Nevada are designated as maternity care deserts. This is another place where doulas' resource and commitment to their communities help them thrive. The fiscal note currently, after the first amendment, came down a little bit. But I'm sure the folks who'll be able to, Stacey Weeks will be able to explain that a lot better than I. But really what it means to Nevadans and what it means to doulas is that we can do the work that we love and that we were called for and not have to sacrifice our families, our lives. We might even be able to get off of Medicaid ourselves if we were able to earn a living wage. Thank you.
Thank you so much. I'll ask if there's someone from the Healthcare Financing and Policy in the room. Good morning, Ms. Weeks. You see that there was fiscal note that was submitted on April 5th, but there was a revision on May 8th, and it looks like it came down in one area, up in another, but could you just address the fiscal note?
Madam Chair, Stacey Weeks, Division of Healthcare Financing and Policy. Excuse me, this morning. Yes, the revised bill did a couple of things. It created a cost-based rate, so allows us to pay closer to cost for doulas. This bill is a good example of where more investments are needed to better pay providers, and this is one example. It also adds an incentive payment for doulas to try to encourage them to serve the rural regions where we have gaps in services. Currently, we only have 10 doulas enrolled in our program. It's a good example of where funding is necessary to support these programs so we can adequately pay providers. The total based on these changes are for the general fund for state share for both systems and services is $371,406, and that's for the biennium. And then the total computable, which includes the federal funds and the state share, so you'll be investing about $1,050,541 into rate increases, essentially.
Ms. Weeks, could you just state those amounts one more time? They were a little bit different than what we had calculated.
Sure. Stacey Weeks for the record, Division of Healthcare Financing and Policy. Madam Chair, if you add up the medical services total for state funds, so there's, like for any Medicaid services, we draw down federal share, the state share cost, and you add that to the state share of the actuarial and system costs related to these changes. The total is $371,406 for the biennium. And then it's about a little over $700,000 for the federal funds that we'll be able to draw down.
Perfect. Thank you so much. Members, any questions? All right, not seeing any. We'll invite you both to take a seat back. And we'll invite up to the table anyone who would like to testify in support of Assembly Bill 283.
Thank you, Madam Chair and members of the committee. For the record, my name is Paige Barnes with the Ferrado Company, here today on behalf of the American College of Obstetricians and Gynecologists. We really appreciate the Assemblywoman's work with us in the Policy Committee, and we are here to express support today in the Money Committee on AB 283. Thank you.
Thank you.
Good morning again, Madam Chair, members of the committee. Joan Hall, representing Nevada Rural Hospital Partners. My members have those maternity deserts. We need all the help we can get, and we support this bill. Thank you.
Thank you so much. Is there anyone else here in Carson City that would like to testify in support of Assembly Bill 283? Not seeing any. Is there anyone in Las Vegas that would like to testify in support of Assembly Bill 283? Not seeing anyone approach the table. BPS, do we have anyone on the phone line that would like to testify in support of Assembly Bill 283?
If you would like to testify in support of Assembly Bill 283, please press star 9 now to take your place in the queue.
Hello, good morning, Madam Chair and members of the committee. My name is Edna Lena Martin. That is EDNALYNA MARTIN. I am one of the Medicaid providers under doulas here in Las Vegas. I have recently enrolled as a provider with Medicaid in hopes to offer my services to those who are deserving of the support, but previously have not been able to access or afford a doula in the private sector. So even if it has been a long and lengthy process, I was actually motivated to continue not only for the purpose of ensuring access to care for these families, but by the support of my fellow doula co-op members. So my family grew up very poor, and one of my biggest dreams is to support families like my own to receive the care that they utmost deserve. So the difference between working for $450 versus $1,500 per client is the difference between me being able to offer intentional, authentic care and providing families with the time and focus that they really deserve. So if I were to pick a living wage for the work I'm providing, then I'll be able to focus on doula work without having to pick up small jobs to make ends meet, and additionally ensuring care for my babies while I care for my clients. So I truly believe, and I really respect what Jolena said, that doulas facilitate positive outcomes for mothers, especially concerning mental health. There are countless dynamics to consider for birthing parents navigating the transition to parenthood, especially for the first time. So knowing that many Medicaid families come from low-income communities, they actually must work harder to ensure food and shelter are secure. So this means that they don't afford any time or money or attention to their own physical, mental, and emotional health during pregnancy and afterwards. I have also seen such a positive impact on families from viewing or experiencing their birth even afterwards, from a place of informed consent, bodily autonomy, and safety as a result of educating themselves and choosing supportive care providers like us doulas. So I'm in full support of AB 283. Thank you.
Thank you so much. PPS, do we have any other callers?
Yes, Chair.
Dear members of the committee, my name is Claire Murdoch. I'm a birth and postpartum doula serving the Reno, Carson City, and Lake.
I think we lost you.
Hello, can you hear me?
We can hear you now.
I have become an approved Medicaid provider because it is important to me that I am able to serve the disadvantaged community that so desperately needs the support of doulas. However, if AB 283 is not passed, I would be unable to serve Medicaid clients because it would be financially unfeasible for me. I am a working mother and need to be able to support my family. Being reimbursed only $450 for Medicaid clients is not a livable income. The work that doulas do for the disadvantaged community is vital. I want to financially be able to support this demographic and will not be able to do so if AB 283 is not passed. Thank you.
Thank you. Next caller?
Good morning, members of the committee and Chairwoman Danielle Monroe Marino. My name is Emily Barney, for the record, EMILYBARNEY. I am the executive director for the Doula Co-op, and that is a new Nevada nonprofit that was started in the wake of the last session and the Medicaid bill passing, allowing doulas to work with Medicaid clients. My organization has been working towards enrolling doulas as Medicaid providers since its inception last July, and we are thrilled to have 10 doulas, all members of the Doula Co-op, as part of the Medicaid program, and we have 9 more who are working through the pipeline right now. As Jolena said, it's between a 3 and 6 month process, most likely a 6-month process for most doulas, as we are doing the billing, the enrolling ourselves. And so we urge you to pass this bill and support the doulas and the families that we will support in turn. Thank you so much.
Thank you. Next caller?
My name is Andrea Cole, ANDREAKOELL. I'm a birth and postpartum doula in Northern Nevada. My loved ones were my motivation for becoming a doula in the first place, and they're primarily in the Medicaid demographic. Being able to serve everyone who would benefit from a doula who would otherwise not be able to access us is vitally important to me. It's unfortunately not an option to support my family and support this demographic without the implementation of a living wage. I'm calling in support of this bill. Thank you.
Thank you. Next caller.
Hello. Thank you, Madam Chair and members of the committee. My name is Samantha DeAndrea, for the record. That's SAMANTHADEANDREA. I am calling in support of AB 283. I am a single mother and a doula in Northern Nevada, as well as another co-founder of the Doula Co-op. And I am also a Medicaid recipient, as well as a Medicaid enrolled provider. Finally, after a pretty intense process to become enrolled. The point that I just hope to sharpen in everyone's understanding is that I am a Medicaid recipient, serving Medicaid recipients, as are many of the other doulas in the Doula Co-op who we have enrolled and recruited to do so. So to make this sustainable, I need to be able to be paid equitably, as do all other doulas, and I urge you to support this bill. Thank you so much.
Thank you. Next caller.
Good morning, Madam Chair and members of the committee. My name is Tiara Flynn. I'm a Las Vegas native, small business owner here in Southern Nevada for the past 12 years. I'm also an Air Force veteran and a recent full spectrum doula. I've been a birth worker for the past 5 years, and I recently launched my full spectrum doula practice in August of 2021. What led me down the path to become a doula in the first place was my own experiences with birth and postpartum. Through my personal experiences and training to become a doula, I learned about the incredible lack of access and support from mothers and families through the entire reproduction spectrum. So in addition to birth and postpartum, fertility, loss, abortion, surrogacy, and adoption. This challenge is elevated for underserved and underrepresented communities, for example, the Medicaid community. I was extremely hopeful when I first learned that doulas can now apply to become Medicaid providers in Nevada. However, as you've heard previously, a couple of times now, currently there's some concerns within the Medicaid population and the doula community when it comes to the reimbursement rates. It's simply not sustainable for a doula's livelihood or for doulas to scale and grow their businesses. As I stated previously, I've been a business owner now for 12 years. So I understand the burnout rate when it comes to for small business owners and the several barriers that make it challenging for us to have and achieve long-term sustainability. Most doulas are forced to seek private clients who can likely afford their services over Medicaid clients because of that. Ultimately, my concern is that as doulas, we're not reaching the population needing our support the most due to those financial barriers. The primary objectives of AB 283 can potentially absolve some of those barriers and challenges. If doulas can achieve sustainability in our practices and our businesses, we're available to the populations who desperately need our services. This will ultimately solve some of the country's top challenges related to maternal mental health, postpartum depression, postpartum overdose and suicide, maternal and early childhood morbidity, and so much more. So this morning, I thank you for hearing my testimony, and I urge you to support this bill. Thank you.
Thank you. Next caller.
Hello, Madam Chair and other members of the committee. My name is Sue Foltz, S-U-E, F as in Frank, O-L-T-Z. I am a doula and a retired from a 30-year career in laboratory diagnostic medicine. I knew after attending my first birth as a doula for a homeless pregnant teenager on Medicaid how vital it was to support these vulnerable women in this population. This new bill, AB 283, will not only support a living wage for doulas, but will save the state of Nevada in downstream healthcare costs for Medicaid insured births. Doula care has been researched thoroughly, and it is proven that doula care throughout a pregnancy, labor, and birth will decrease the amount of medical interventions during the birth, leading to healthier outcomes for mother and baby. I strongly support AB 283, and I am confident and hopeful that this legislative council will see not only the health and well-being benefits for the Medicaid population and the cost savings to the state, but will also respect the work of a doula and reimburse their work at a living wage. Thank you.
Next caller.
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. Coming back to Carson City, do we have anyone that would like to testify in opposition on Assembly Bill 283? Not seeing anyone here in Carson City and not seeing anyone approach the table in Las Vegas. BPS, do we have anyone on the phone line that would like to provide testimony in opposition of Assembly Bill 283?
If you would like to testify in opposition to Assembly Bill 283, please press star 9 now to take your place in the queue.
Hi, my name is Natalie Doyen, and I just want to be clear that I am in support, not in opposition, of AB 283. I am a birth and postpartum doula. I serve our rural communities kind of out in the desert of Fallon, Nevada, Reno. I belong to the doula co-op of Reno as well, and I am also going through the process as a Medicaid provider. I just wanted to make it known how important it is that we are supporting these families and women that require extra assistance, not only through birth, but financially. And not only our birthing women, but our women that support them, such as the doulas. I am a military spouse and mom of 3, and I take care of my family based on this income. The $400 is not a sustainable or a living wage for the services that we provide and the care and emotion that goes into our families. So again, I just wanted to make my vote known as I am in support of AB 283. Thank you.
Thank you so much. Do we have any other callers in opposition of Assembly Bill 283?
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. Then we will move to neutral testimony. Is there anyone here in Carson City that would like to provide neutral testimony on Assembly Bill 283? Not seeing any and not seeing anyone at the table. In Las Vegas, BPS, do we have anyone on the phone line that would like to provide neutral testimony on Assembly Bill 283?
If you would like to testify neutral on Assembly Bill 283, please press star 9 now to take your place in the queue. Caller with the last 3 digits 511, you are unmuted and may begin.
Good morning, Madam Chair, members of the committee. My name is Teresa Bank. I am a Public Health Diversity Advisor at the Larson Institute within the School of Public Health at the University of Nevada, Reno. For my neutral testimony, I want to share what research has shown. Studies have demonstrated the impact doulas have on birth outcomes and the saving costs associated with their intervention. Women on Medicaid with doulas have a 22% lower odds of delivering preterm, which may lower NICU admissions. Many studies, including a 2013 CAC study, reported doula support births had near universal breastfeeding initiations compared with the general Medicaid populations. And among African American women, 92% of those with doula support initiated breastfeeding compared with 70% of the general Medicaid populations. Again, I want to reiterate that increasing Medicaid reimbursement rates can serve as an incentive for more doulas to become Medicaid providers. Thank you.
Thank you. BPS, next caller.
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. We'll ask the sponsor of the bill if you have any closing comments. All right, seeing no closing comments, we will close the hearing on Assembly Bill 283. And we will move on to Assembly Bill 296 and open the hearing on Assembly Bill 296. As amended, revises provisions governing instructional time in public schools, and invite Assemblyman De Silva to the table. Good morning.
Okay, good morning, Madam Chair and distinguished members of the Ways and Means Committee. I'll say as a member of the hardest working Assembly Government Affairs Committee, I got to give it up for y'all. I mean, y'all have been working the hardest over these past few days. My name is Ruben De Silva. I'm the Assemblyman from District 28. And this bill, Assembly Bill 296, what it really does here is address the issue of a standardized test creep in our schools. I know it's been thoroughly vetted by many different interests who had a stake in this. We've come up with the final language here, including an amendment that we just introduced last night, which you should all have a copy of. And this bill is now looking at capping standardized testing, certain tests in our schools statewide at about 2%. This is some guidance that we've received from the U.S. Department of Education, both from the Obama administration as well as the Trump administrations have both supported this. And we're just looking at bringing this sort of policy recommendation to Nevada. And to address the fiscal concerns here, I have Mr. Daniel Stewart. And if there's any technical questions too, we have Dr. Pearson at standby there in Las Vegas. So I'll turn it over to Mr. Stewart.
Thank you, Chair, members of the Ways and Means Committee. My name is Daniel Stewart. I'm testifying on behalf of the Clark County Education Association. Just want to talk a little bit about the history of the fiscal notes and where they're at. I do believe we're at a point now where they are all zero, even one that hasn't been introduced officially posted yet. So with the reprint, White Pine County took their $25,000 note down to zero. I think they even submitted that in Nellis. And there may be somebody here from White Pine County to confirm that if you need it. Washoe County also committed to removing their note, and I believe one of their representatives may have reached out to the chair, some of the members of the committee directly to let them know that with the reprint they are removing their note. Yesterday, upon the passage of this, or upon the notice of this hearing, we got contacted by the Nevada Department of Education indicating that they would have an additional fiscal note. And so we worked with them, and that's where this amendment came from, and I'll walk through it just really quick. But it's actually been fortuitous, this amendment, because not only is it going to get the fiscal notes down to zero, but I think it actually eases some of the policy concerns that may have lingered on with this bill, even in its first reprint. So this conceptual amendment only makes very little language changes, but it actually is pretty substantive when it comes to the change of what we're doing. So in section 1.5 of the bill, it currently reads that the department shall provide assistance to schools that violate the limitations described in paragraph A. It also says they need to come up with a plan of corrective action. What we've done with this amendment is we've essentially told the Nevada Department the bill tells the Nevada Department of Education that all they have to do between now and July 1 of 2025 is develop the plan of what it would look like to provide assistance to schools and what a corrective action program will be. And I believe the superintendent's here, and she can speak that would remove whatever note they have. But I do want to mention the policy implications of this too. I know there's been some fear from some of the school districts that they were immediately going to be under the thumb of the Nevada Department of Education for something that was a relatively new program. They weren't going to know necessarily how to count it, how to deal with it, and make all of a sudden the Nevada Department of Education becomes an enforcement arm. With this amendment, this basically strips at least unless this legislature chooses to give them authority in the next legislative session, this strips them of any enforcement authority. All their role is now is to provide a plan. They don't have to provide assistance. They don't have to issue plans of correction. They just got to tell this body, based upon the data and the districts that they receive, what it would look like if the Department of Education were to get in and try to help these schools limit their testing and increase their instructional time, significantly increase their instructional time. And so I'm hoping that eases some of potentially the last lingering policy concerns about having the NDEs be the police. But like I said, it does take the notes down to 0. Thank you.
Thank you. And we had a significant, extremely large fiscal note from NDE. So if you could just come up and put on the record that that is now gone down to $0, that would be great. Good morning.
Good morning. Thank you, Chair Monroe Moreno. Members of the committee, for the record, my name is Joan Ebert, and I serve as the State Superintendent of Public Instruction. And as described in the bill, working with the Assemblyman De Silva, the removal of having the department work with every single school within the state, which we have over 750, on how much time they spend on testing, does remove the fiscal note, and we will be able to work on the plans that now are proposed in this amendment.
Perfect. Thank you. And just to make sure that I have the right amendment, it's this amendment, correct?
That's correct, Madam Chair. Ruben De Silva for the record. Thank you.
We also had another conceptual amendment. Are we doing anything with this one?
Daniel Stewart for the record. I'm glad you mentioned that. I was going to do that ahead of time. That was what we were working with White Pine and Washoe. It was put in at the last minute, and there was we didn't know if it was going to make it all into the reprint. It ended up making it all into the reprint. So that second thing has been covered by the bill in front of you.
Perfect. Thank you. Thank the three of you for testimony. Members, any questions for any of the presenters? All right, not seeing any. We will move to support. If there's anyone here that would like to provide testimony in support of Assembly Bill 296, I invite you to the table. Good morning.
Hello, Madam Chair, members of the committee. My name is Kaylin Evans. I am the president of the Washoe Education Association, and we represent the certified professionals in the Washoe County School District. Very quickly, just wanted to thank Assemblyman De Silva for this legislation. The over-assessing of our students is a critical issue in schools, not only to address the loss of instructional time that it creates, but also the loss of fun and learning that a lot of our students are experiencing. The saddest time in school, if you go to a school, is during SBAC testing week. I know that is separate from what we can require, but I think any opportunities that we can use to limit the amount of testing and increase instructional time will have a great benefit for our students. Thank you very much.
Thank you. Is there anyone else here in Carson City that would like to testify in support of Assembly Bill 296? Not seeing any. We'll be going to Las Vegas. We have one person coming to the table. You can start as soon as you're ready.
Thank you, Chairman Moreno. My name is Brenda Pearson, and I'm speaking for the Clark County Education Association. This bill specifically increases the amount of instructional time that students will be taking within the school day. This is going to reduce the amount of assessments that are required, and we think that this is going to really bridge that gap between the learning loss that occurred over COVID. So we stand in support. Thank you very much.
Thank you so much. Is there anyone else there in Las Vegas that would like to testify in support of Assembly Bill 296? Not seeing any. BPS, do we have anyone on the phone line that would like to testify in support of Assembly Bill 296?
If you would like to testify in support of Assembly Bill 296, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Then we will move to opposition. Is there anyone here in Carson City that would like to testify in opposition of Assembly Bill 296?
Good morning.
Good morning, Chair and members of the committee. For the record, Tess Opferman here on behalf of the Washoe County School District. I want to thank the sponsor. He has worked with us significantly on this bill. We have been able to remove our fiscal note, so we really appreciate steps in that direction. However, we do still have concerns with the content of the bill itself. We know that state and federal testing is the primary burden on teachers and students, and we feel this bill doesn't do anything to directly address this. It doesn't give any power to NDE to limit testing. It just gives them the ability to look at testing and try to create a plan. So we are still in opposition to the policy itself, but have removed our fiscal note. Thank you.
Thank you.
Good morning, Madam Chair and members of the committee. For the record, my name is Mary Przenski here representing Nevada Association of School Superintendents, and we also want to thank the sponsor for eliminating some of the really what we thought draconian penalties in the first bill, which he did take out. So we appreciate that the financial implications in that respect have been taken out. We're in opposition still with the bill because of just the parameters of it, trying to carry this out, having teachers try to monitor their time, time's money. That's, how much time are they spending on testing? It just is seems unrealistic. Different tests take different time periods to prepare children for the exams, and so we are still in opposition of the bill. Thank you.
Thank you.
Good morning. Patricia Haddad, Director of Government Relations for the Clark County School District. Also in opposition to the bill, although we do support the spirit of it and are very grateful to Assemblyman De Silva. This has gone a long way from its initial printing. A couple of things to note. Reporting in aggregate, so the districts would report in aggregate, but of course that burden still falls on the individual educators to be able to track the time that it would take in preparation. And ultimately the time that students are taking in testing. The other piece that I just wanted to mention was in the 2021 session, SB 323 was passed, which was a holistic look at assessments across the state and has involved a number of stakeholders. The Clark County School District, a number of our folks have been involved, as well as people from other districts, from RPDP, the Regional Professional Development, as well as NDE. To look at what this specific number should be, this 2% testing cap that is indicated in there. And so we think it's really important that that work is ongoing and that can be honored, and that we don't take a step back from the really hard and really important work that has been done up to this point by moving quicker than our state and that our stakeholders have in identifying what that most appropriate number would be. So thank you so much.
Thank you. Not seeing anyone else here in Carson City to testify in opposition. Is there anyone in Las Vegas that would like to testify in opposition of Assembly Bill 296? Not seeing any. BPS, do we have anyone on the telephone line that would like to testify in opposition of Assembly Bill 296?
If you would like to testify in opposition to Assembly Bill 296, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. So we will move to the neutral position. Is there anyone here in Carson City that would like to provide neutral testimony on Assembly Bill 296? Not seeing any, and not seeing anyone in Las Vegas. BPS, do we have anyone on the phone line that would like to provide neutral testimony on Assembly Bill 296?
If you would like to testify neutral on Assembly Bill 296, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. We will ask the bill sponsor if you have any closing comments.
Thank you, Madam Chair and committee members. Ruben De Silva for the record. I just want to thank all the stakeholders who have been working on this piece of legislation. It has really been a wide and diverse array of folks who have come together to create a bill now that isn't a perfect in the end, but it is a step in the right direction. I know that there were some concerns about the tracking and reporting of the actual tests themselves and the time allotments of those tests. I think we have significant safeguards in the legislation to deal with this moving forward, I should say. And we look to some significant work at hand. You know, the over testing of our students is a significant issue. It's something that parents constantly complain about. Teachers have issues with the loss of instruction time. And it's if you have any students in our schools, they'll tell you for sure that we do test way too much. So I think this bill is an appropriate and a really a moderate step in the right direction. And I'm looking forward to continuing to work with the stakeholders to address the issues that they may have moving forward.
Daniel Stewart for the record, just real quickly, addressing some of the comments were made in the opposition testimony. I also greatly appreciate the opportunities we've had to work with the districts on this. They've been good partners. The only thing, and I also appreciate their concerns for what burdens it might have on teachers. I just would like to point out that between CCA and WEA, probably have 95% of the teachers represented, and they are both in support of this bill. Thank you.
Thank you so much. And with that, we will close the hearing on Assembly Bill 296. And with the fiscal notes being addressed, we'll be able to work session that bill later today. Moving on to the next bill on our agenda, it's Assembly Bill 349. It establishes the Nevada Wildlife Conservation Program, and will invite Assemblyman O'Neill to the table.
Thank you, Chair. Members of the committee, I'm P.K. O'Neill representing Assembly District 40. Today I am happy to present to you with Assembly Bill 349, which establishes a Nevada Wildlife Conservation Program. The bill has already been vetted in Natural Resources, passed out unanimously, so I won't go through the policy itself. We'll talk about the money, and I do have an amendment to the bill. There physical notes have all been removed, should be showing 0 in Nellis. And I will wait for your confirmation, Chair, before I move on.
You can continue.
With that, I will move over to, I have a friendly amendment that I'd like to propose. I had originally talked about only having 3 members on the Wildlife Committee. However, in conversation with various stakeholders to this, there is an amendment sitting up on Nellis, or I have a proposed amendment here that will expand the board from the 3 members to, actually I'll just go through, it'll be the easiest way to do it. The board will consist of the following members: one member appointed by the governor, 1 member from a non-governmental conservation organization in Nevada appointed by the majority leader of the Senate, 1 member from a mining industry appointed by the minority leader in the Senate, 1 member who is an attorney with expertise in real estate or personal estate planning appointed by the majority leader in the Assembly, and 1 member representing the energy corporations with operations in Nevada appointed by the minority leader in the Assembly. The director of wildlife is the ex officio member. That should deal with the amendment, and I'm open for any questions or discussions.
Thank you for that. And does the amendment have any effect on the fiscal impact on the bill? Thank you. So I'll ask that you do that as a floor amendment. I did notice one thing in the amendment that's a policy thing. I know that we've always kept balance in those who are appointing members to a committee. Could you just explain why the majority leader of the Senate has an appointment, the minority leader of the Senate has an appointment, the minority leader of the Assembly has an appointment, but it does not speak to the Speaker of the Assembly? And we did find it. It's on line 22. We found the speaker on line 22.
Yeah.
Thank
it
you.
should be there.
And then my other question for you, there doesn't seem to be an appropriation for this fund, so it's just setting up the enabling language for future legislative bodies?
Actually, there are no appropriations. It is setting up this commission to receive donations from various entities to work on the issues.
Perfect, and I think we have one question for you, Assemblyman Watts.
Thank you very much. Thank you very much, Madam Chair. Thank you, Assemblyman, for the presentation. Again, I just wanted to note that this is an idea that that came up that I didn't have room for. I appreciate the minority leader bringing this forward. I think it is going to have a significant benefit for wildlife. And I know that we were trying to have some conversations about how to get that balance in the appointments to make sure, again, that there's kind of some equal footing between different stakeholders. And I think this is a really good way to do that, both in the mix of who's making the appointments and the different sectors that are represented that I think are likely to make contributions for the benefit of our wildlife. So I just wanted to say that even though this doesn't relate to the fiscal aspect, that I appreciate the work that has been done on this by the Assemblymen and by other stakeholders.
Thank you so much. So I have you on the record. Donations, contributions, and grants. No appropriations this session. You won't come back next session and ask for more money. Is that what you said? Or is that what I wanted to hear you say? Just joking. It's okay.
No.
It's okay.
PK O'Neill for the record. No, Chair, I'll say donations, et cetera, and I won't be asking for appropriations this session and next session, okay? Then the future we'll discuss later.
Sounds good. Members, any other questions or comments? See none. Thank you so much for the presentation. We'll invite anyone to the table that would like to provide testimony in support of Assembly Bill 349.
Hi, good morning, Chairman Moreno and members of the committee. My name is Chris Brooks, B-R-O-O-K-S, representing Arevia Power. And Arevia Power is a renewable energy developer in the state of Nevada and across the West. And we think this is a great thing for the state of Nevada, so that industries such as mine and companies such as mine can make meaningful contributions to Nevada's wildlife and the conservation of it. So thank you.
Thank you. Good morning.
Thank you, Madam Chair, members of the committee. For the record, my name is Kyle Davis today on behalf of the Coalition for Nevada's Wildlife. We are in support of this bill, supported it in the policy committee as well. We think this is going to be a great avenue, especially in cases where we might have situations where it's an emergency and we need to take care of wildlife in a quick fashion. This will allow for that flexibility. Thank you.
Thank you. Good morning.
Good morning, Madam Chair and members of the committee. For the record, my name is Christy Cabrera-Georgeson. I'm the Deputy Director of the Nevada Conservation League, and we're here in strong support. Our wildlife and open spaces make Nevada unique and make it a great place to call home for both wildlife and animals. We think this will be a really important tool to help conserve our wildlife, and we urge the committee's support. Thank you.
Thank you.
Chairman Ro Moreno and members of the committee, my name is Jane Amone, and I'm the External Affairs Director for the Nature Conservancy in Nevada. The Nature Conservancy supports Assembly Bill 349 to create a wildlife conservation program and fund. Nevada is one of the few Western states that lacks dedicated conservation funding to support wildlife and wildlife habitat. The creation of such an account is a good first step to meeting the conservation needs for our state. Healthy ecosystems contribute to cleaner air and water. Nevada is fortunate to have rich biodiversity across our state. Restoring and maintaining habitat for Nevada's incredible wildlife is a good investment for our future. Thank you so much.
Thank you. Seeing no one else to testify in support on Assembly Bill 349 here in Carson City, not seeing anyone at the table in Las Vegas. BPS, do we have anyone joining us by phone that would like to testify in support of Assembly Bill 349?
If you would like to testify in support of Assembly Bill 349, please press star 9 now to take your place. Chair, there are no callers choosing to testify at this time.
Thank you so much. Then we will move to opposition. Is there anyone here in Carson City that would like to testify in opposition of Assembly Bill 349? Not seeing any. Not seeing anyone in Las Vegas. BPS, do we have anyone on the phone line that would like to testify in opposition of Assembly Bill 349?
If you would like to testify in opposition to Assembly Bill 349, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Then we will move to the neutral position. If there's anyone here in Carson City that would like to testify in the neutral position on Assembly Bill 349, I invite you to the table. Good morning.
Good morning. Good morning, Chairman Moreno and committee members. I'm Alan Janae, Director of the Nevada Department of Wildlife. I'm here to testify neutral on behalf of the Nevada Department of Wildlife. While the department does have the ability to collect donations through the Wildlife Trust, large amounts of money such as these that are intended for broad purposes to implement multiple projects over multiple years would be handled more efficiently through this conservation program. AB 349. This proposed program is organized exclusively for charitable donations and endowment. The existing Wildlife Trust Fund is used for specific dedicated purposes where the contributor will define specific project. This program, this proposed program will allow a donor to donate funds for the broad purpose of preserving, protecting, managing, and restoring wildlife and wildlife habitats. The Board of Nevada Wildlife Conservation Program will then decide the purpose of the funding that is granted to the Nevada Department of Wildlife. Having a board allocate the funding separate from the agency will help bring diverse perspectives and management over funding. This bill has been amended to diversify and broaden the membership of the board after many discussions with the invested stakeholders. This program will be at a charitable fund administered by an organization such as the Community Foundation of Northern Nevada, exempt from taxation purposes, who is able to receive anonymous donations and is organized to provide support to the department in its effort to preserve, protect, manage, and restore natural resources in Nevada. The department has long-standing working relationships with the Community Foundation of Northern Nevada through the Dream Tag program. Grants for the program that are distributed to the department will enhance its ability to more timely react to threats or impacts to natural resources while also providing required match to grant funding. The department sees this program as being able to provide a steady source of non-federal funding to the agency over time. Other states that have used such programs as this achieve their conservation objectives while providing their match requirement. Novel revenue sources such as these proposed in this bill help the department keep license fees for hunting, fishing, and boating affordable so families can easily enjoy Nevada's outdoors. And with that, I'd like to thank Assemblyman P.K. O'Neill and the stakeholders that invested the time in developing this concept. Thank you.
Thank you so much. Not seeing anyone else here in Carson City to provide neutral testimony and not seeing anyone at the table in Las Vegas. BPS, do we have anyone join us on the phone line that would like to provide neutral testimony on Assembly Bill 349?
If you would like to testify neutral on Assembly Bill 349, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. We'll invite the sponsor back with any closing comments. Thank you. And with that, we will close the hearing on Assembly Bill 349, and it's another bill that we will work session a little later today. And we'll go to Assembly Bill 425 and open that hearing. Assembly Bill 425 revises provisions governing net metering.
Thank you very much, Madam Chair, members of the committee. For the record, Howard Watts, representing Assembly District 15. It's my pleasure to present Assembly Bill 425 for your consideration today. This bill looks to establish a net metering program for affordable housing developments in the state of Nevada. It aligns the requirements for those developments to align with new federal incentives that would help cover 50% of those solar project costs. That is really what the bill seeks to do. Members, you do have a proposed amendment looking to tune up some of the provisions of the bill in conversation with different stakeholders. However, it is a policy amendment, so I would be glad to move that on the floor or bring it for consideration in the other house, as it does not affect the fiscal note. I will get right to the fiscal note. I was notified by the Public Utilities Commission, which had submitted a fiscal note on the bill, that they have now determined there will not be a cost to the agency, and they have removed their fiscal note. I provided that in writing to the chair and to fiscal staff this morning. Unfortunately, I don't think the representative from the commission was able to join us in person. That concludes my presentation. Glad to answer any questions.
Thank you for the presentation, and no, I did not have the updated fiscal note in my file. We get the files together the night before so I can take them home and look them over, so I do not have it, but it is on Nellis. And the amendment, the conceptual amendment is this one, and it only has policy issues, nothing that would affect the fiscal note, correct?
Howard Watts for the record. Yes, Madam Chair, that is correct.
Thank you so much. So we ask that you do that as a floor amendment. And I don't see anyone here from the PUCN, although I may not be correct, to address their fiscal note. But since we have it on Nellis, members, any questions for the presenter? Seeing none, Assemblywoman Anderson.
Thank you, Chair. And I've had some people come and talk to me over the last 2 days about some issues, but I think they're mostly policy issues. So if I could talk to you offline later today about it, I'd greatly appreciate it.
Howard Watts for the record. Glad to do that. Thank you.
Anyone else? Not seeing any. Thank you so much. We'll ask you to step back. And we'll invite anyone to the table that would like to testify in support of Assembly Bill 425.
Thank you, Madam Chair and members of the committee. For the record, Christy Cabrera-Georgeson, Deputy Director of the Nevada Conservation League, here in support of AB 425. All Nevadans should be included in the transition to a cleaner, healthier future, and this bill makes strides to do that. It will also help us better allocate and leverage funds from the Inflation Reduction Act, so we urge the committee support. Thank you.
Thank you.
Good morning, Chair and Committee. My name is Kira Capra with Ovation Development. Ovation Development and the Mulaski family are committed to providing high-quality, affordable housing for folks in Southern Nevada and are also committed to lowering their carbon footprint and providing clean energy resources for the residents of their thousands of units. Ovation believes all residents, regardless of socioeconomic status, deserve a quality home that helps to strengthen individual lives, families, and community. AB 425 certainly furthers that goal. Ovation urges support of AB 425, and we thank this committee for bringing it forward.
Thank you so much. Go ahead.
Chairman Ro Moreno and members of the committee, my name is Jana Moan with the Nature Conservancy in Nevada. The Nature Conservancy supports Assembly Bill 425 to allow the shared net metering at low-income housing. Climate change is one of the biggest threats to our mission, and we support policies that will reduce greenhouse gas emissions. AB 425 will expand the opportunity for more Nevadans to benefit from renewable energy generation where they live. We support this bill because it promotes the equitable distribution of climate mitigation opportunities and outcomes, including for those in low-income housing. Thank you so much for hearing our comment.
Thank you.
Thank you, Chair and members of the committee. My name is Eric Zhang, ERICJENG, here on behalf of 1APN Nevada, advocates for the fast-growing Asian and Native Hawaiian Pacific Islander communities here in the state. AB 425 addresses two of the most pressing issues we have in our state: housing by lowering utility bills for affordable housing, and tenants get to participate in net metering, and confronting climate change by creating more solar energy. Our organization has advocated for the federal Inflation Reduction Act and all its tax savings. We would love to see state changes to take full advantage of federal incentives. Urge the committee to pass AB 425 so Nevada still leaves savings on the table. Thank you.
Thank you. Go ahead.
Hello, Chair and members of the committee. My name is Jamarion Williams, and I'm the Government Affairs Manager for Western Resource Advocates. Western Resource Advocates supports AB 425. Everyone in Nevada deserves to benefit from solar energy, and low-income renters stand to benefit the most from utility bill savings. There are also new federal tax incentives that was created in the Inflation Reduction Act that will be awarded and available for solar projects installed on federally available affordable housing. Without AB 425, most solar projects on affordable housing will not be viable, and we will not get to benefit from this federal funding. So on Western Resource Advocates, we would like to urge your support of this bill. Thank you.
Thank you.
Good morning, Madam Chair, members of the committee. Christine Hess with the Nevada Housing Coalition. We support AB 425 and would like to thank Assemblyman Watts for bringing this important bill forward. Utility costs are real, and when we consider all of our renters that are paying more than half of their income on their rent costs, any savings is particularly important. It's a personal favorite of mine when I think about my Nevadan neighbors that are living paycheck to paycheck, what a small savings could be. I consider this a renter equity bill and also an opportunity for Nevada to be more competitive to go after those federal funds. So thank you so much.
Good morning, Madam Chair and members of the committee. For the record, Mindy Elliott with Flynn Judici Government Affairs, today representing Reno Housing Authority, Nevada Rural Housing Authority, and Southern Nevada Regional Housing Authority. We certainly want to thank Assemblyman Watts for this bill, this innovative solution as we look to build affordable housing in our state. This is just one opportunity that will benefit all Nevadans. So thank you so much.
Thank you. Go ahead.
Chair and members of the committee, Jessica Ferrato here today on behalf of the Solar Energy Industries Association. We're here in support of the bill. We want to thank Assemblyman Watts for all the work that he's done on it. We supported this bill in the policy committee and continue to support it here. Thank you very much for your time.
Thank you. Go ahead.
Thank you, Madam Chair and members of the committee. For the record, Paige Barnes today on behalf of Advanced Energy United. We supported this bill in the Money Committee and are here to support it as well. Thank you.
Now we have the mic on. Okay. Not seeing anyone else here in Carson City to testify in support of Assembly Bill 425, and not seeing anyone at the table in Las Vegas, BPS. Do we have anyone on our phone line that would like to testify in support of Assembly Bill 425?
If you would like to testify in support of Assembly Bill 425, please press *9 now to take your place in the queue.
Madam Chair. Dora Will Martinez with Nevada Disability Peer Action Coalition. We ditto and we urge you to pass this bill, and thank you to the sponsor. Have a good day.
Thank you. Next caller.
Hello, my name is Tracy Smith, spelled TraceYSmith for the record. I am with Faith Organizing Alliance. FOA is in strong support of expanding clean energy opportunities for families and affordable housing. We supported this bill in the Policy Committee and gave more extensive comments there. Thank you.
Thank you. Next caller.
Good morning, Madam Chair and the committee members. This is Dr. Mary House, spelled Maryhouse, and I'm the president and CEO of CHR Inc., which stands for Caring, Helping, and Restoring Lives, and the First Lady of Mountaintop Faith Ministries. I do want to thank Assemblyman Watts for this bill and let you know that CHR is in strong support of AB 425. This bill expands solar access to the people that need it the most, with lowering the utility bills, which have skyrocketed this year due to high cost of volatile and out-of-state methane gas. This bill will make it possible for renters in low-income, multifamily housing to benefit from stable and affordable solar energy while taking advantage of federal state incentives. I would like to ask you to help reduce the energy burden for low-income households by supporting this bill. Thank you so much for hearing me out.
Thank you. Next caller.
For the record, this is Emily Woodall, campaign manager with Dream.org. We work at the intersection of environmental and economic justice and work to ensure that states are able to take full advantage of federal funding from the Inflation Reduction Act. We just want to echo the statements in support of AB 425 and just want to thank the sponsor and the committee for your time.
Thank you so much. Next caller.
For the record, this is Stephen Lesser with Sunrun, the largest rooftop solar provider in the United States. Unfortunately, there is next to no solar on affordable housing in Nevada today because the economics are too difficult. We support this legislation because it will help change that by allowing Nevada to apply for the new federal IRA tax credits that are designed specifically for solar on affordable housing. Where there is solar on affordable housing in neighboring states, it's saving building owners thousands of dollars on their utility bill each year, and it's saving low-income tenants an average of $44 a month on their utility bills. The solar industry is ready to bring these benefits to Nevada, and we appreciate the work of the sponsor to bring this legislation forward. Thank you.
Thank you. Next caller.
Chair Monroe Moreno and members of the committee, my name is Barry Levinson, a volunteer member of Sierra Club's Legislative Committee. On behalf of the club and our more than 30,000 members and supporters, I'm speaking in support of AB 425. As we all know, Reno and Las Vegas are two of the fastest warming cities in the country. Low-income residents bear the brunt of these effects on their health and well-being due to the high cost of cooling their homes. These residents spend a much higher percentage of their incomes on utilities, i.e. they have a higher energy burden. AB 425 will provide net meter solar on low-income housing, allowing the residents and building owners to partake in the benefits of solar energy at a reasonable price. This will help shelter them from the inevitable increases in the price of electric power from our utility companies and reduce the state's greenhouse gas emissions from fossil fuel power plants. AB 425 will help low-income Nevadans reduce their energy burden and participate in our clean energy future while helping our state meet its greenhouse gas reduction goals. For these reasons, we urge you to support this bill. Thank you very much.
Thank you. Next caller.
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. Then we will move to opposition. Is there anyone here in Carson City that would like to provide testimony in opposition of Assembly Bill 425? Not seeing any. Not seeing anyone in Las Vegas. BPS, do we have anyone on the phone line that would like to testify in opposition of Assembly Bill 425?
If you would like to testify in opposition on Assembly Bill 425, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. And coming back here to Carson City, is there anyone that would like to provide neutral testimony on Assembly Bill 425? Not seeing any, and not seeing anyone in Las Vegas. VPS, do we have anyone on our phone lines?
If you would like to testify in opposition or neutral to Assembly Bill 425, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Any closing comments? Thank you. Then we will close the hearing on Assembly Bill 425. Moving on our agenda, we will go to Assembly Bill 441 and open that hearing. 441 revises provisions relating to the industrial insurance. Good morning, and thank you for patiently waiting.
Good morning, Chair Monroe Moreno, Vice Chair Bacchus, and members of the Assembly Ways and Means Committee. My name is Jason Mills, Jason Mills, and I am here on behalf of the Nevada Justice Association today, and with me is Mr. John Noble. I wanted to report to you, Chair, that we do have an amendment that has to do with policy that is before you. That came about by way of meeting with the Division of Industrial Relations about their fiscal notes, and they pointed out some policy issues that were in error in the original draft, and we did, of course, address those. As you are well aware, Madam Chair, you yourself and a few other members here are on the Commerce and Labor Committee, so for those that aren't on that committee, we did work diligently with the stakeholders, including gaming, insurers, employers, the Nevada self-insured employers, organized labor, as well as the trial lawyers that I represent. And it came out of that committee on a policy unanimous. The amendment that we have today on the policy issue, again, is to address a couple of, I would essentially say, some errors that were left out. I'm happy to go over those if you'd like me to. I did present them. I'm also here to speak on behalf of the policy, the fiscal note that we received on this particular bill. We were unable to get the agencies to remove the fiscal note, but I would like to just make a few comments as to why we believe that the fiscal notes may, in fact, not be as significant as indicated in the reporting. Essentially, that the underlying nature of this bill and where the fiscal notes are being generated are essentially from three different aspects if you look at their fiscal notes, and that is that there's additional need for staffing to address the increased number of permanent partial disability evaluations that this change in the law would bring. That's number one. The increased number of investigators that they would need for running benefit penalties as a result of a change in the jurisdictional language in this particular bill. And lastly, software updates that they need to address what they call their CARDS system. That is the Division of Industrial Relations system that they use to assign these permanent partial disability evaluation physicians. With regard to those 3 points, I've noted that many of the fiscal notes that are attached from the local agencies as well as the state agencies indicate an increase in the number of permanent partial disability evaluations on the order of 25 to 33 to 50% more permanent partial disability examinations that will take place as a result of this change. However, I've been practicing in this field for more than 23 years, and I was actually one of the people that helped bring about AB 458 in the 2017 session that allowed for this independent medical examination to exist. And that independent medical examination has been used for the last 5 years to get these additional PPD examinations. We noted from prior to the change in 2017, there were roughly around 5,000 average permanent partial disability examinations per year happening. After we got the change in 2017, it looks like the average number is around 5,380 per year. That's an increase of around less than 400 permanent partial disabilities per year, and that does not account for a population increase. So that is just raw numbers. That said, since those changes in the statute resulted in less than an 8% increase in the number of PPDs, we can't begin to wrap our minds around how we would see an increase of nearly 2,000 additional PPDs per year, as the self-insureds, the employers, the insurers, and gaming are the folks that actually pay for these. As my understanding, they don't believe that they're going to be hit with these dramatic increase as well. So that said, we don't think the additional staffing would necessarily be required as a result of this bill, although we obviously always support any additional staffing that the Division of Industrial Relations to help the Nevada injured workers and employers to move these cases along. Next, with regard to the fiscal note that was placed on for the additional investigators, I would point out that the change in the statute that we have in this particular bill only indicates that jurisdiction for the division to continue to administer an investigation on these claims extinguishes after 90 days. Why that is important is currently, after 90 days, it is already deemed denied, meaning if we make a request to the division to do a benefit penalty assessment or investigation, if they fail to do that in 90 days, then that is by law, already existing law, deemed a denial. So it exists now as a matter of law that matter has been denied, and then the parties can litigate it going forward. As I understand from their fiscal note, the division has around 120 to 130 of these complaints that they currently can clear per year. However, they receive right now more than 230 per year. So it's my understanding that they already have an existing need for more investigators to deal with the existing loads. Lastly, with regard to the software updates, it's my understanding that the distinguished committee has already allotted somewhere on the order of $2 to $2.1 million to the division for an increase in their card system. So the fiscal note that's attached to the change or the increase here, it seems to us that would be a beneficial time to actually just address these changes that we have brought forth at the same time that they were doing other updates that you all have already issued funds for. With that, I don't have anything further. Any other comments by Mr. Noble? And of course, I am free for any questions of any members of your committee, Madam Chair.
Thank you so much. Mr. Noble, do you have any comments?
John Noble with Employers Insurance, JOHNKNOBEL. Mr. Mills has walked through the majority of the sections for this bill, so I'll just finish briefly with those sections important to employers, since I know you all have floor coming up soon. Section 2.5 in the proposed amendments references the physical location of insurance adjusters who adjust workers' compensation changes. And this is really just an outgrowth of the changes we've all experienced during COVID as businesses are more easily able to operate virtually across state lines, and the insurance industry is really no different here. This section would just allow certain licensed adjusters to adjust claims out of states. And this legislation also includes important safeguards by requiring representatives be available to Nevada employees during Nevada business hours, and then still requires adjusters working on behalf of the self-insureds be located within the state. And then finally, any out-of-state adjuster would still be required to be licensed pursuant to Nevada law. These are very high-demand jobs, and what we're doing here is really just providing flexibility to expand services in Nevada. Next, we've got section 6.3 and 6.7 in the bill, which just tweaks AB 370 from 2019. And what that bill does, or did, is put in a 2.3% cost of living adjustment for workers injured prior to that date. In Nevada, we have lifetime reopening, so there's still thousands of claims on the books that date back to as far as the 1950s that need to be administered. The majority of these claims are administered by Employers Insurance Company, just because we used to be the state industrial insurance system before Nevada privatized workers' comp in the late 90s. So when the legislature passed AB 370, Employers was responsible for providing the vast majority of those COLAs. The AB 370 process requires insurers to pay those COLA adjustments to the claimants, which are then submitted to DIR for verification and reimbursement via assessment on all insurers. However, 370 lacked a mechanism to handle COLA reimbursement payments to the insurers in a timely manner. So all this section is trying to do is create that mechanism by establishing definitive timelines for determination and payments, and then also clarifying the dispute resolution process should one arise. And then I'd also just like to flag quickly that we had a repealed section in the bill drafted. I believe it's on, section 10, page 27. That section is no longer being repealed after some discussions with DOI. We don't think the language was quite ready for prime time yet, so we'll be working on that in another session. And then just to echo Mr. Mills, when we reviewed this language, we didn't see that there'd be a drastic increase in PPD claims. So with that, I'm happy to answer any questions.
Thank you so much. The amendment that you are referencing, there was an amendment presented, I believe in the Commerce and Labor Committee, and that is in part of the reprint, the first reprint. And there's an additional amendment that's been submitted.
Jason Mills, for the record, that's correct, Madam Chair.
Okay. I'm not sure if any of the members have that. Do you all have that amendment? Yes. Okay. It didn't make it to my file. I'm having my copy brought into me. And then if we could have Business and Industry and the Department of Administration step up to speak to their fiscal notes, that would be great. Good morning.
Good morning. Matthew Tuma, Deputy Director for the Department of Administration. I'm here and can speak on the risk management fiscal note, as risk is a division in the Department of Administration. We looked at impacting us as managing risk management in the workers' compensation program for the state as an employer. That's what we oversee at administration. So Section 6 would expand coverage for accepted claims to request a second permanent and partial disability evaluation. And our estimate would be that these could increase by 25% and cost roughly $41,000 per fiscal year. And then that the result of these claims or these second evaluations, we could see an increase in approximately 10% in what we distribute for workers' compensation claims. And so that's how we get to our roughly total of $600,000 per fiscal year to impact the risk management workers' compensation fund. And I'm available for any questions.
You heard the presentation from the presenters. With the numbers that they've had, they've seen the increase that don't align with your calculations, but these are your calculations. So my question for you is, this is not a general fund account. This is fee funded. Will you be able to absorb these costs?
So, Matthew Tuma, Deputy Director for Department of Administration. We've pursued work programs in previous fiscal years and in our current fiscal year for increases in our workers' compensation liability. Many of the members who serve on the Interim Finance Committee will probably remember that we submitted a work program this fiscal year to increase our workers' compensation payments expenditure authority by over $6 million at the January IFC. So we would tap into reserves that are collected. I will say during our current biennium, we stretch those reserves to a minimum. Now those should be replenished with the revising of rates, with the increasing of these rates for agencies as we head into the next biennium. But we did reach dangerously low in our reserves for risk management and did contemplate having to increase rates mid-biennium. So that's always one of the evaluations that we would do is if we don't have reserves sufficient to meet the liability for the state's obligations, then we would look at raising rates mid-biennium.
Thank you for that. And with the amendment that was presented this morning, would that have any effect on the numbers, the totals of included in your fiscal note?
Matthew Tuma, once again, Deputy Director for Department of Administration. It's our belief that this would not impact our fiscal note for this legislation.
Perfect. Thank you so much. Thank you for your comments on the fiscal note. And you were just speaking for the Department of Administration. You were not at all referencing the business and industries. Are you covering both, all of them?
Matthew Tuma, Deputy Director for Department of Administration. I am here solely to represent administration's fiscal note, not any of the information for any of the other departments.
Perfect, thank you. Is there anyone from BNI, the Division of Industrial Relationships, here? All right. Well, unfortunately, they are not here in the audience to address any questions we have on their fiscal note. Members, do you have any questions for the presenters? Not seeing any. They may be worn down last night. So I thank you so much for the presentation and the amendment, and we will reach out to BNI, Industrial Relations, to have a conversation with them on their fiscal note.
Thank you, Madam
I'll
Chair.
invite to the table anyone who would like to provide testimony in support of Assembly Bill 441. Good morning.
Good morning, Madam Chair. Leah Case here on behalf of the American Property Casualty Insurance Association. APCIA is in support of AB 441 and appreciates the modernization efforts. Thank you so much.
Thank you. Not seeing anyone else here in Carson City to provide testimony in support, and not seeing anyone at our table in Las Vegas, BPS. Do we have anyone on our phone lines that would like to provide testimony in support of Assembly Bill 441?
If you would like to testify in support of Assembly Bill 441, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much, and we will move to opposition. Is there anyone here in the room that would like to testify in opposition of Assembly Bill 441? Not seeing any, and not seeing anyone at our table in Las Vegas, BPS. Do we have anyone on the phone line that would like to provide testimony in opposition of Assembly Bill 441?
If you would like to testify in opposition of Assembly Bill 441, please press star 9 now to take your place in the queue. Caller with the last 3 digits 835, please press star 6 to unmute yourself.
Thank you so much. We will move to our position.
Hello? Hello, am I on?
Yes, you are.
Thank you, Madam Chair. Dalton Hooks. There's a little bit of delay on the video, so unfortunately, I'm calling in support. This is Dalton Hooks, and I'm representing the Nevada Self-Insurers Association. We have supported this bill in the policy hearings. There have been some amendments, and I'm here to just offer a couple of clarifications. With respect to the increase in number of PPDs, the members of the NSIA have worked with the sponsor on this bill and reached an amicable solution. But the bill by its nature is going to increase the number of PPDs. It expands the pool of people who are available to have PPDs paid by the insurers or TPAs. So I do believe that there will be an increase in terms of the amount. I think that's to be determined. With respect to Section 10, which concerns the licensing of adjusters, we're still working with sponsors regarding that language. As it sits, it appears that the language that we're working with now would allow out-of-state adjusters to not have to sit for a Nevada test while those in the state would. And that's just we believe, a simple clarification. So with those clarifications, I yield. Thank you.
Thank you so much. Next caller.
We're still working with the sponsors regarding that language. As it appears that
Caller, are you there?
we're working with now would allow. I'm here. Out-of-state adjusters.
You can go ahead.
Madam Chair, members of the committee, my name is Charles Nort. I'm president of Nevada Alternative Solutions. We are a TPA in Las Vegas. We believe that if this bill passes, there will be jobs lost for Nevadans, and it's a bad bill for Nevada. And the reason why we say this, there's been a brick and mortar statute in Nevada for decades. There are a number of other jurisdictions that have similar statutes in play as well. And as such, one of those is, well, many of them are Oregon, Idaho, Washington, Montana, and New Mexico, and as well as Nevada. Nevada is a very unique jurisdiction for workmen's compensation. If this bill passes and allows out-of-state adjustment as the new language is implemented in here, I believe that I'll lose between 5 and 8 employees. And at the other hearing, the assembly hearing as well, there were many, many adjusters that testified in opposition to this bill simply for the fact that they'll lose their jobs as well. Many of those have 20 years of experience, single mothers, et cetera, as well as in my particular TPA, 20 and 15 years experience. In the Section 3, specifically A, and also the Section 3 where it says in that format, there's basically no requirement for any experience to adjust claims out of state. Yes, they have to be licensed adjusters. However, the problem with that is who's going to ensure that they've got any experience in adjusting claims in Nevada or any experience with Nevada law? I'm sorry. Additionally, there's a program at UNLV that requires the participants to go for risk management. Now, if out-of-state adjusting is allowed, local programs at UNLV and UNR, specifically the law school and also this particular risk management, I believe they'll be impacted by that as well, simply because of the fact that who's going to be able to use a license here if they have to go out of state to use it? The fact that many of the carriers that do business require
a specific individual assigned to their accounts as well. And so I'm concerned about no experience, no supervision, also impacting the DIR with respect to their enforcement and accountability. And I would leave it at that, Your Honor, committee members and Madam Chair.
Thank you so much for your comments. Next caller.
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. Then we will move to the neutral position. Is there anyone here in Carson City that would like to provide neutral testimony on Assembly Bill 441? Not seeing any, and not seeing anyone at our table in Las Vegas. BPS, do we have anyone joining us on the phone line that would like to provide neutral testimony on Assembly Bill 441?
If you would like to testify neutral on Assembly Bill 441, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. We will ask presenters if you have any closing comments.
Madam Chair, Jason Mills, no further comments. Just appreciate your consideration and that of your committee.
John Noble, just with one point to the opposition testimony, Nevada is only one of 8 states that still has the brick and mortar requirement. Most states have already moved into allowing out-of-state adjusting. That being said, Nevada's license, if you're licensed within the state, there's 26 states that adopt us reciprocity-wise. And this is just a very high-demand career, so I think right now what we're looking at is more of a lack of adjusters than anything else, which is why we're looking for this type of flexibility. Thank you.
Thank you so much. Thank you both for joining us, and we will close the hearing on Assembly Bill 441. And we will open the hearing on the last bill on our agenda so far for today, and that will be Assembly Bill 445, which revises provisions relating to the mental health of children, and invite Assemblywoman Newby to the table.
Thank you, Madam Chairwoman and members of the Assembly Ways and Means Committee for hearing Assembly Bill 445. My name is Saber Newby. I am the Assembly person for District 10 in lovely and diverse central Las Vegas. The impetus for AB 445 was really a October 2022 report from the Department of Justice on the state of mental health services for children in Nevada, and it found that Nevada lacks community-based mental health services for children, and as a result, it institutionalizes children at a much higher rate than we should, and then is probably allowable under the ADA. And even in those institutions, or in those situations where institutionalizing or putting children into institutions is appropriate, we still lack those resources in Nevada, and so oftentimes those children are sent hundreds or thousands of miles away. And so I began to think about how we could think differently about this problem and bring additional tools to bear. And I was reminded of a Ani DeFranco song, a line in it, which is, "Every tool is a weapon if you hold it right." And so AB 445 really is bringing to bear a number of different economic and incentivizing tools that Nevada uses on a regular basis to incentivize other businesses to come to the state. And it takes those tools and it applies them to the provision of children's mental health, with the idea that we would be able to recruit more service providers or encourage current service providers to expand their services to our children in this state. Obviously, this is not the policy committee, this is the money committee, so I'll dive right into those fiscal notes. There are two fiscal notes. One is from the Department of Taxation, and that stems from the GoEd tool. What I did in the bill is to adapt the GoEd process to Children's Mental Health Services, and it allows new or expanded service providers to apply for tax incentives through sort of a modified GoEd process. And as a result, I believe the Department of Taxation is interested in getting a couple of personnel to take in those applications, to manage them, and to make sure that the adequate tax breaks, if you will, are given to those companies. The second fiscal note is from the DHHS, Healthcare Financing and Policy. Back to taxation. There's a very large fiscal note on that, the $5 million. That comes from the modified business tax. That's another tool, if you will. You may recognize it from a certain scholarship program that we have in our state. And what I've done is take that front part of that system and that incentive for the donations for corporations to get the tax credit on their modified business tax, and I apply it to Children's Mental Health Services and rates on the back end. So you will see that also on the Department of Taxation fiscal note, because it is, as we all have learned, negative revenue. Now, going on to healthcare financing and policy, this also, after the first year in which one of these providers is providing services to our children in Nevada, they may apply for cost-based reimbursement. And this is a tool that we currently use elsewhere in DHHS. It's used in the community Nevada Certified Community Behavioral Health Centers. I had to write all of that down. And so that, moving from regular Medicaid rates to the cost-based rates that these providers could apply for, is the genesis of the fiscal note, I believe, in healthcare financing and policy. They did get to me this morning and said that actually there was an error in that fiscal note, and so it's actually gone down to, I believe, 4.2 million in the fiscal year. I believe that revision was provided to staff, and I also copied the chairwoman. That was just earlier this morning, but I understand that they are here to also speak to that. Now, folks on Ways and Means will know also about the federal matching dollars that we can draw down. And you'll see in the DHHS fiscal note that we do have some federal dollars. My intent was to be able to structure the modified business tax credit program to be able to then take those funds and match them to federal funds, and then be able to use those in those rates for children's mental health. And I believe that DC FP can possibly speak to that. That's really a very quick overview, as I know it's been a long morning and we're supposed to be on floor. I'd be happy to answer any questions.
Thank you for the presentation. I think my first question would be, did you work with the Department of Health and Human Services in the drafting of the language and to get to where we are today?
Yes, Madam Chairwoman. We did meet early on in the session and have had sort of ongoing email conversations since.
Thank you. Then I will invite those that have fiscal notes on the bill. We have Healthcare Financing and Policy and the Department of Taxation. I believe those are the only two. Join us at the table. And if you could speak to the fiscal notes and actually how this will impact your divisions if this legislation becomes law.
For the record, Lynette Aaron with the Division of Healthcare Financing and Policy. So the division would like to reduce our fiscal note based on reduction in the vendor support costs, which was originally $1,585,724 to $845,469. And that would be a total cost for the biennium with those changes of $4,246,378, including $1,681,412 in general fund.
And the general fund portion, once more, is
$1,681,412.
Thank you for that. Okay. And then for the Department of Taxation. Looks like
you,
some
Madam
big
Chair.
losses here.
Thank you, Madam Chair. Jeff Mitchell for the record, Deputy Director with the Nevada Department of Taxation. As mentioned in the presentation, there are abatements on
Could you move the mic just a little closer to you? For some reason, that's our soft mic.
I'll try to talk louder too. Jeff Mitchell with the Nevada Department of Taxation. As mentioned during the presentation, there are certain abatements that are offered through the Governor's Office of Economic Development, as well as within this bill there is a credit program for those that make a donation to a specified account. The account is to improve mental health services for children. The fiscal note that we have provided is for personnel to help administer that credit program to make sure that it's tracked correctly and applied to the appropriate accounts, and for correspondence to and from taxpayers and to the different divisions that we need to coordinate with.
Thank you. So on your fiscal note, you show a loss of $5,142,803 in FY24, and an additional loss of $5,175,117 in fiscal year 25. Correct?
Jeff Mitchell for the record, that is correct. $5 million is the credits that are being offered as negative revenue, and the difference between that and the total is the personnel costs for the two positions that we are requesting.
Okay, and with those two positions, this legislative session, we've heard a lot about compensation packages and things like that for our state employees. Do you believe you'll be able to fill those positions moving forward?
Yes.
Thank you. We hate to set up a new program and then not have the personnel to actually make sure those programs are successful. So thank you for the yes in that. Members, any questions? I know some folks are hastily looking through the bill. Any questions for the presenter or the fiscal notes that have been presented? Not seeing any. They may have a question after we get through testimony, so stay tuned. Thank you so much. It's an innovative idea.
Thank you, Madam Chairwoman. I neglected to mention DCFS does not have a fiscal on this, and I do have an amendment that's a policy amendment for some processes for GoEd, but it does not affect the money aspect of the bill. So I'll offer that on the floor.
Perfect. Thank you. So with that, we will move to testimony in support of Assembly Bill 445. Go ahead.
Hello again, Madam Chair, members of the committee. Leah Case here today on behalf of NAMI, the National Alliance on Mental Illness Nevada chapter, in support of AB 445. There was a mention of this negative revenue, this $5 million potential impact, and we would look at that instead as a $5 million investment in children's mental health. Over the 2021 interim, about $14 million was dedicated to children's mental health and wraparound services through the IFC process, through ARPA funding, in response partially to the DOJ report That amount has not been fully appropriated this legislative session. I think we're up to about $2 million, maybe $5 million total, depending on what those budget closings look like. So we're still a little bit short of a comprehensive children's mental health program being fully funded here in the state of Nevada. So this gets us part of the way there. I would also like to support Section 10, which would provide that reinvestment into our providers. We know our Medicaid rates are really low in the state, and I've had some great conversations with Assemblywoman Newby on ensuring that the provider rate increase from this fund would impact both fee-for-service Medicaid and managed care Medicaid, which will likely be statewide by 2026. And so anything impacting the fee-for-service provider rates would be phased out by then. So NAMI Nevada is in support and looks forward to furthering children's mental health progress in the state. Thank you.
Thank you.
Good morning, Madam Chair. Jeanette Bells on behalf of the Nevada Psychiatric Association. Not really much I can add. Leah knows a great deal about this, but I did want to thank the sponsor for her creative use of a solution that hasn't historically been used in this space. Thank you.
Thank you. Morning.
Barry Cole, Barrycole, testifying on behalf of anything that improves children's mental health. We're not Argentina. We don't disappear people. And what I'm saying by that is let's not send everybody out of state. Let's address our own issues. We have that ability. We're growing our graduate medical education to give us more child and adolescent psychiatrists. What we need are more beds, more facilities, and then ultimately more resources in the community. I won't say our friends on the East Coast because they're in the Department of Justice. They're giving us this year to solve the problem ourselves. They've already tipped their hand and said next year we get to go to court. So you can do this because you choose to, or you can do this next year because there's a bayonet in your back. But those are really the two choices we're winding up with. I ask you to be proactive as opposed to reactive. Thanks. Oh, and I'm part of the Nevada Psychiatric Association too.
Thank you so much. Not seeing anyone else here in Carson City to testify in support, and not seeing anyone at our table in Las Vegas. BPS, do we have anyone on the phone line that would like to testify in support of Assembly Bill 445?
If you would like to testify in support of Assembly Bill 445, please press star 9 now to take your place in the queue.
Good morning, Madam Chair, members of the committee. Stephen Collins for the record, speaking for the Assemblywoman.
I'm sorry, I think we lost you. Could you repeat your name?
Stephen Cohen.
Thank you. Next caller?
Good morning, Chair, members of the committee. This is Catherine Nielsen again, joining you by phone now from the Nevada Governor's Council on Developmental Disability. Be quick. Individuals with intellectual and developmental disabilities are at an increased risk of co-occurring disabilities with mental health conditions. These mental health conditions include but aren't limited to major depressive disorder, bipolar disorder, anxiety disorders, etc. And people with IDD and mental health conditions often experience symptoms that lead to services being provided within the mental health service system framework. And most mental health professionals do not receive sufficient training on the needs of the diverse population. Our council does recognize the challenges that policymakers and administrators face in addressing the current needs of mental health care in Nevada. Current available treatment options in Nevada are not sufficient to serve the current needs of this community. Increased access to mental health services is necessary to meet the needs of those with IDD and mental health conditions, and we wholeheartedly support this legislation. Thank you.
Thank you. Next caller?
Good morning, Madam Chair. This is Darrell Martinez representing the Nevada Disability Action Coalition. I would like to underscore the last person who was in person there in Carson that said that let's be proactive. I represented my coalition on the call with the DOJ last year, and we need to be proactive in this matter. I also would like to ditto Catherine Nielsen and the other people who are in support, and thank you to Madam Newby for bringing this bill, and why not? Please support this bill. Thank you.
Thank you. Next caller.
Chair, there are no additional callers on the line.
Thank you so much. So coming back here to Carson City, is there anyone in the room that would like to testify in opposition of Assembly Bill 445? Not seeing any and not seeing anyone at the table in Las Vegas. BPS, do we have anyone on the phone line that would like to testify in opposition of Assembly Bill 445?
Chair, the public line is open and working, but there are no additional callers at this time.
Thank you so much. So we will move to the neutral position. Is there anyone here in Carson City that would like to provide neutral testimony on Assembly Bill 445? Not seeing any and not seeing anyone at the table in Las Vegas, and knowing that we do not have anyone currently on our phone line, we'll ask the sponsor of the bill if you have any closing comments. And that is a no. So with that, members, we will close the hearing on Assembly Bill 445. And we are going to take a 5-minute recess. Okay, we're going to call this meeting back to order. And we're going to do a few work sessions before we break to grab a bite to eat and go into recess, then come back a little bit later. So we will open the work session for Assembly Bill 137. And as we heard, we'll turn it over to our fiscal analyst.
Thank you, Madam Chair. Assembly Bill 137 as amended expands the provisions relating to the confidentiality of information regarding referrals of an individual to a program for fetal alcohol syndrome to all fetal alcohol spectrum disorders. I would note that there was a fiscal note provided by the Division of Healthcare, Finance, and Policy. And as such, if this bill were to move, a total of $825,840 would have to be authorized in the bill, of which $273,313 would be provided for general fund appropriations over the 2023-2025 biennia.
Members, I will accept a motion to amend and do pass as amended.
Madam Chair, I'd move to amend and do pass as amended.
We have a motion from Assemblywoman Bacchus, a second from Assemblyman Watts. Any discussion on the motion? Seeing none, all in favor, please say aye. Aye. Any opposed? The motion carries unanimous of the members present, and we'll assign that floor statement to Assemblywoman Peters. So, members, I thought we'd be able to get through a few for the work session, but we're being called to the floor, so go downstairs. I'm sorry. We will be in recess, and we'll come back at the call of the chair. But looking at the schedule that we're going to have for today, we may not get back here till about 5-ish. So we will stand in recess.